and let's start. I'd like to welcome everyone to the Southline Community Schools School Board Study Session on August 5th, 2020 at 7 p.m. Mr. Abate, please call the roll.
Okay, Mr. Clark.
Here.
Mr. Tell.
Are you unmuted?
Yes, here. Sorry.
Mr. Schwegler.
Here.
Mr. Dashner.
Here.
I'm here, Mr. Kennedy.
I'm here.
And Ms. Hanshaw.
Here. That it's all 7 of us. We have a quorum. First up is public comments. We have quite a few, so I will begin. The first one is from Angela Harvey, and she states, I am concerned with the disruption to our children if there is exposure and need to be out of school for 14 days when there is a positive case of COVID. I hope the administration and board consider how the inconsistencies will impact the student's emotional health. As a family, we could use additional information and understanding of the different scenarios that could happen with positive cases. If there is a chance that our students will be in and out of the classroom every couple of weeks, then it is really not worth the attempt to have them return in person. I will have a 7th grader, 6th grader, and an ECC preschooler. If my 6th grader has possible exposure and is sent home for 14 days, does that mean his siblings are as well? At that rate, will they ever really be in a classroom? How does the transition to home learning for that 14-day period impact my students if their classes and classmates continue in person? I feel there is still a lot of questions I need to understand before I can make a decision on the best choice for my children. And if the questions aren't answered, we may default to the virtual option just because of the unknown. I understand we are all working to keep our families safe and healthy. Thank you for being a part of the process. Next up is Dana O'Connor, and she states, how will you address the need to clean the classrooms according to the CDC guidelines, given the fact that the current Southline Community Schools budget only allows for a cleaning every other day? Next up is Virginia, and she states, before a decision is made regarding remote start or virtual only learning, please take into consideration working parents. The current virtual model will not work for working parents that work between 9 to 4 in your virtual model. Families who have working parents need options since the kids may be with sitters, family, daycare, while the parent is working, and those avenues cannot be expected to stay on top of the virtual learning with the students. I believe, and I know other parents do too, that the district needs to come up with an additional option so we can teach our students on the time that works best for us and not at a set time. It is also, in my opinion, that with my daughter barely passing last year's grade and really struggling in her academics and is behind in her academics, that if the district decides virtual or remote start, the district needs to provide parents with assistants or tutors for the students who are behind to help them get where they need to be on top of the planned curriculum. I, like most parents, are not qualified to give our children the additional assistance a teacher or resource room teacher can provide. Rebecca Terry states, start the year 100% virtual and protect the teachers and students. And next up, we have Miss Susie Steele, and she was planning on calling in to discuss Edgenuity and transcript grades. Miss Steele, are you?
Hi, good evening.
Oh, yes.
Yes. Hi, thanks for taking my comment tonight. Yeah, my comment is in regards to the grades that students receive through the Edgenuity courses. And whether you're aware or not, I'm not sure that historically these courses, they're just reflected as a G grade on student transcripts. And after weighing several variables, we're looking at possibly our son having several of these courses through Edgenuity if we opt into the virtual learning this year. So with that concern, we didn't want to have a transcript that reflects lots of G grades because we were told that could potentially have a negative impact on their like college admission decisions. So I reached out to Lisa Kudwa or Kudwa, I'm not sure how to pronounce her name, I'm sorry, in the district this week. And she stated, quote, we are planning to request that the board revise that grading policy to allow Edgenuity or other 21F course grades to be used in the GPA for the school year given the circumstances, end quote. She did say, though, that the board's decision on this policy revision would not be known before families are required to commit to a method of learning by August 14th. So I just wanted to make the board aware of these concerns that exist for our son I would suspect probably for some other families in secondary education this year. And I would just respectfully ask that the board consider supporting the revision of this policy when you are requested to do so. Thank you.
Thank you so much for calling and for the comment. All right, next up is Mr. Andrew Stoller, and he is also planning on calling in.
Hi,
Hi, go right ahead.
good evening. Thank you for affording me this opportunity to speak. As you said, my name is Andrew Stoller, and I say with pride that this September will be my 21st first day of teaching in the Southline Community Schools. Today, I speak here just representing myself. I'm passionate about teaching and have been so fortunate to live out my dream in this incredible district. For 20 years, or after 20 years, some of you probably don't even know me because I've prided myself as being a really good member of this team. Whether I agreed or disagreed with decisions or actions or edicts of the district, I've always wholeheartedly executed the wishes, policies, and programs that have been agreed to. But this time is different. I can't sit idly by. In the spirit of John Lewis, it kind of seems like the right time for, as he said, some good trouble. No one here today would wish these times on anyone, and as a historian, I can truly say it's unprecedented. And as a father of both a high school and middle school age daughters, I can only imagine the stress that all of you are under and the difficulty of balancing what is right or wrong. But you have the power to address the fears and concerns of all stakeholders. But that begs an important question. What is power without purpose? My purpose is teaching. It's my calling, and I work hard to be the best teacher I can be. I believe I was chosen to do this. But without a safe environment, no one can feel comfortable enough to allow for any meaningful learning. Every cough, sneeze, or sniffle will be met with fear and anxiety by the students in my classroom. Learning about the Reagan Revolution or the rise of fascism seems trivial when there's a chance you might think that you could possibly send your grandparent, parent, or even yourself to the hospital because you went to school. So in my mind, our main purpose is to protect our students. And you have the added burden to work to keep me and my family, including my daughter, who is high risk, safe as well. If the school board and the administration cannot adequately answer questions that will inevitably arise out of a positive test, lack of social distancing, or providing high quality guest teachers, or even simple questions about how do we handle the paper load or group work or classroom cleaning, then how can any of us feel comfortable sending kids into that environment? I want nothing more than to be in my classroom on September 8th and look out and see those excited and nervous ninth graders. And as I work to teach them the skills that I push them to attain, the critical thinking skills, I thrive as a teacher on seeing the kids get it. When that light bulb goes on, I want to be there like I have for 20 years, listening to the kid who's going through a really tough time or finding the right words to just make a smile or just a smile to make their day a little bit more tolerable. But what I fear and what you have the power to prevent is for me walking into my classroom and seeing an empty desk where a child once learned because they're in a hospital or even worse, and knowing that we all had the power and the purpose to prevent that. I implore you to consider what school is going to look like or be like when that happens. We talk about the mental health of our kids, but what happens to their mental health when they see that? I ask of you to have the courage to do what's right. I don't know what that is, and I know how hard you're working to figure it out, and I appreciate your time. I thought it was important to speak out today. Thank you so much.
Thank you for your comments and for your service to our district. Next up is Michael Rizzi. Are you there, Mr. Rizzi?
Yeah, sorry, I just had to unmute.
No problem.
Thank
Go
you,
for it.
everyone. Yes, so my name is Michael Rizzi. You may or may not know my last name from both my brother and sister-in-law, but I am my own person. So I wanted to just talk about this myself. Me and my wife, we have two children that are elementary school ages in 5th grade and going into 5th and going into 2nd grade. Both of us, both me and my wife, work during the day. And we, probably as many other students or parents of students, also have to work during the day. As we have seen in the past, earlier, we were actually going through for my second grade student who was in first grade at the time, starting to have an IEP plan for him. Because Corona hit, we were unable to go through and finish this. However, he still does have issues needing special needs for his education. As all of you are probably aware, the Individuals with Disability Act states that we are supposed to have free and good education, appropriate education for all students who are of age. And parts of this is having an IEP to be able to understand children with disabilities and the needs that they need. I've noticed that when we came back to having to go through school online, I felt that my student was getting he did not get to have the individual education program, and he was not getting appropriate public education. Being to have to be on a call remotely does not work for my son. He has ADHD and is on the autism spectrum. So he needs to have specific people who can come and help, who are specialized to do this. Neither me nor my wife are trained to be teachers. We both work, so we do not have the time to work during the day to be able to help with the necessary needs of both my son and my daughter. And I bet there's also many other parents that are in the same situation. Now, also, one of the other problems that we have through remote learning is that students are not going to be able to have the same amount of education as in person. So we're going to have a generation of students who are going to fall behind. And if we have online or remote learning only, that's also going to potentially affect the wives who are the mothers, may I say, of these students, because disproportionately, women are going to be affected, the mothers. They are going to be the ones who disproportionately are going to have to reduce their jobs, their working hours, and take on the time to teach their children. Now, I'm not saying that men are not going to have to also take some of this, but disproportionately it will affect women. This is an issue that will cause problems in all future, and I don't know how we can go about going and fixing this. So if we have to go and do online learning, we are going to ruin the future of families. And I don't know how we can go and fix that. So I just want to say that we need to not go with online learning to begin with. I am concerned that, yes, we need to worry about what happens if students are sick or ill, but on average, we need to care about the average student and the majority of the students, and not what might happen to one or two of them falling behind. We need to also be able to, if that one or two fall behind, we need to have good work and ways to catch them up. That's just my concerns. Thank you very much.
Yeah, thank you for your call. Okay, next up is Erin Wilson, and she states, please offer an option for in-person school 5 days a week. We are very happy with the proposed return to school plan and do not want any delays to face-to-face instruction. My children are ready and eager to be back in the classroom. Next up is Scott DeStramp, and he states, recently Canton District Schools announced it will conduct the 2020-2021 school year virtually. If South Lyon intends to follow the same direction, I would like to understand the following. Number one, what is the level of participation parents need to be involved with the virtual studies? How does the South Lyon School District expect a family with 1 or 2 working adults to support these types of virtual studies? There is no consideration for working families. Are we expected to quit our jobs to support this virtual studies? Number 3, if the district does approve virtual studies, have you considered long-term effects on younger children in K to 6th grades? Virtual training is not at all adequate, nor does it provide the in-class collaborative teamwork and social interaction that is necessary for young minds. And number 4, what COVID-19 data is being used to make a decision that going back to school puts students at risk? Next up is Andrea Wilkins, and she's planning on calling in. Ms. Wilkins, are you on the line?
Hi, I'm here. Can you hear
Yep,
me?
perfect. Yep, go right ahead.
Okay, thank you for the opportunity to speak. I wanted to speak today out of concern for a remote start to the school year, as I've seen many districts go this route over the past few days. And I wanted to advocate for a return to in-person learning when the school year begins. I'm a mom to an incoming first grader, and I think we can all agree that as parents, we want what is best for our children. That's one of the reasons that I fully support 5 days of in-person instruction in the fall. I believe that going to school and learning in person is invaluable to our kids, and that online or remote learning cannot provide anywhere near the same level of education. Teachers are incredible human beings, and despite their incredible efforts last spring, I watched my child's education levels decline. I spent countless hours late at night worrying and fearing that any progress he made in kindergarten was being undone. But above all else, I watched my child go from a kid that loved going to school and had such excitement for learning become a disinterested and disengaged student. A few weeks into April, he looked at me one day and said, "Mom, I miss learning." I understand that a remote plan would be different than what took place in the spring, but there has been a gross error in this assumption, and I don't think, and I think that assumption is that the playing field would be level for all kids in a remote environment, which is simply not true. There are kids with working parents who are being asked to split themselves in two, or who are simply not able to stay home to guide a remote plan and must find childcare or other tutors. There are kids who simply do not have a safe space at home to learn, and there are kids without access to the resources they need. Further, the inconsistencies for children right now are baffling. I also have a 4-year-old daughter. Both of my children have been in daycare since June 1st because my family could no longer handle the stress that comes with trying to balance careers and at-home learning or childcare, which is an impossible task for a working parent. So in the event that in-person schooling does not occur in the fall, it seems acceptable for my 4-year-old to attend daycare every day, but my 6-year-old is not able to go to school in person, which I don't understand. Additionally, why can my children attend swim class and participate in sports, but learning in the classroom with appropriate safety measures is not considered safe? I feel that life is about risks. Every day we make a series of risk-benefit decisions. We measure those risks and respond in a way that is appropriate for ourselves, our risk tolerance, our environment, and our circumstances. I was very happy to see South Lyon's initial plan, which included both a full-time in-person as well as a full virtual option. That meant that for those for which the benefits of attending school in person outweigh the risks applicable to them could choose to attend virtually. I've done my research, I've spoken to our doctors, and I've calculated the risks of attending in person. And at this point, the risks of remote learning, depression, sadness, decreased social interaction, increased stress, lack of motivation, I feel are far too great. I'm not attempting in any way to minimize the virus, but it is my absolute belief that we can utilize the right precautions and safety measures to give our children the education that they need and deserve. Thank you for your time.
Thank you. Next up is Brian Wilt, and he states, if the school delays the opening and goes fully online, will a separate virtual option still be offered if face-to-face instruction resumes? Next up is Nick Novak, and he is planning on calling in. Mr. Novak?
Hi, I'm here.
Yep, perfect. Go right ahead.
So like I said, like you said, my name is Nick Novak. I'm a 4-year resident of South Lyon. My wife has taught here for 5 years. She's a preschool teacher. Her main concern and my main concern is the health and safety of her and her staff and, her students. She has a lot of elderly, coworkers, staff members, and my worst case scenario is there is an unfortunate outbreak or anything like that, and she has to quarantine for 2 weeks. And what she has been told and what we've been hearing is that a substitute will come in and will take it over. But I always find that the problem with that is we have a sub shortage, and I would like to have that maybe be addressed more, because there have been times where she has woken up with flu symptoms. This was years ago, not, currently in the state we're in right now, and she's almost been pressured to come into school because they just simply can't find a sub. And I'm worried that if she's being told to be quarantined for 2 weeks and, there might be a case where they're not going to have enough subs and we're going to have issues where she needs to come in or they have to cancel her class because we can't find these subs. And I'm worried that maybe the sub shortage might become even more prevalent because a lot of the subs are either elderly or at-risk people, and they might even be more inclined to not choose to come in and risk their lives. So, but that's all I really had to really say. So thank you all for your time.
Thank you. All right, next up is Sue Young. And she states, back to school input by a pediatrician to Northville School Board, I think Southland Community Schools should consider. This is copied from the Facebook page, What's Happening in Our Town Uncensored. Here's an interesting opinion from a doctor who has 40 other doctors backing her opinion. 8/5 of 2020, an open letter to the Northville School Board. After listening to many hours of the school board meeting yesterday, I commend your tremendous effort and time put forth by these deliberations. However, I was also disheartened to hear some of the discussion. There was an open letter sent to the board in advance of this meeting with 40 pediatrician signatures on it from our very own community that has data on transmission of COVID in kids and rates of cases in our community, that was not discussed. I heard several times questions about the science and confusion about what it means. The letter laid out the concerns about why kids need to have some in-person schooling with data to support. As a pediatrician working in a clinic seeing kids for well visits all day, I'm only wearing a simple surgical mask. We screen out any kids that are sick, wash hands, and wipe down rooms. I know it's not 30 kids at once, but sometimes 2 to 3 in a small room, sibling and parent, multiple times a day, multiple providers. Bottom line, our experience since we are in phase 4 across 9 different clinics, thank God no staff, physicians, or patients have been sick with these measures, and it's been almost 6 months of experience. With careful, simple measures, we can all live around this virus with very little risk. Is it different than how we used to practice? Yes. Is it difficult to keep all these measures in place? Yes. Are we always worried someone might get sick? Yes. Is the risk small enough? Sorry, my page jumped on me. Is the risk small enough with careful measures to keep caring for kids and getting their well checkups completed? Yes. I want everyone to be well. I took an oath as a physician to do no harm. Anyone who knows me knows I have the most utmost respect for all teachers and staff and would never suggest to put them in a situation that is harmful. I do honestly believe, since I have the experience with myself and my staff and their other offices, this can be done safely, even with little kids are taking their masks off and on. With phase 4, I'm confident this is a low risk. This risk of COVID is like the risk of a car accident. We know there are risks, yet every day, every single one of us gets in our cars with our kids and takes that risk. With careful measures like wearing our seatbelts and obeying the speed limit, we take the risk even though we could die. We have learned it's important to take careful measures and figure out ways to live around the risk. The real risk is these kids not going to school. The amount of sadness, depression, obesity, lack of academic motivation, decreased social interactions, child abuse, yes, in Northville, and suicides is making me lose sleep for these kids more than the COVID currently, since we are at phase 4. Kids I see every day are affected in ways where in the long term, I firmly believe this is going to hurt them more than COVID. This virus is not a hoax. We absolutely have to take it seriously. Teachers and staff must wear simple surgical masks, even if up close to a kid. With a mask on, their risk is low. Is their risk zero? No. In our lifetime, we are likely never to be at a zero risk, even with the vaccine. However, at phase 4, the risk is low in our community. The exception to this is in our community is Cook. There is much higher risk for spread with our special needs kids, so face shields in addition to masks should be worn. Next month, next summer, next fall, or even with a vaccine, we are still going to unfortunately have risk. Is online safest? Yes, but for how long? Years, and at what cost to kids? This is not a political issue. Right now, it's about the kids. We must do better to find ways to live around the virus and get kids back in school. We have to at least try, and if it doesn't go well, Yes, we can do online learning, but if we don't try, we'll never get to where the kids need us to be. Melissa Heinen, DO, MPH, pediatrician, epidemiologist, and above all else, a concerned Northville mom. Next is Michelle Pratt, and she is a teacher and states, how many students and staff will get sick before you switch to virtual learning? Jacqueline Cherry, and she was planning on calling in representing, or she's a South Lyon teacher. Miss Cherry? You have to unmute yourself. I think it's *6 if you're on the line. Okay, we will come back to her, or she can always call back at the end of the meeting. We'll have another.
Hello.
Yep, go right ahead.
Oh, hi. This isn't Miss Cherry. This is Miss AP, actually.
Oh, sorry.
That's okay. Yeah, my name is Sarah AP, and this will be my 17th year teaching high school history in South Lyon. And I want to start by emphasizing that I love my job. I miss my students. I miss seeing my colleagues, many of whom I count amongst my closest friends. I enjoy the interactive nature of teaching, and I want to be there in person for my students. Distance learning was tough. I've never worked harder in my life. And I know as a parent myself, it was not an ideal situation for students or their families. I mean, my own son wants to go back to school and see his friends. And I understand that childcare is a real concern. And for all of these reasons, I would love to come back to school in the fall. But I do not feel safe returning face to face under the plan presented at the last meeting. And quite frankly, I'm terrified. Most of my fear centers around the fact that this plan does not allow for physical distancing. And I'm speaking tonight to ask you to do what is necessary to protect our community. I apologize, this is a little long. I really want to lay out for parents what school, the logistics of what it will look like if we go back face to face. My biggest concern is class size. The MEA is recommending only opening during phase 4 if districts can actually get students 6 feet apart. And we all know this is not physically or financially possible in South Lyon's case. I want parents to have a clear picture of what going back to school will look like in my classroom, if as predicted, my class sizes are what they were last year. My largest class was a co-taught freshman American history with 36 students in the room. Add in 2 teachers, so 38 people total in my classroom sharing airspace. In order to make the desk fit under normal circumstances, my students sit in pairs, so their desks right up against each other touching. And then each pair of desks touches the pair in front of them, and we end up with these 9 pods of 4 around the room. On test days, I do move the desks into rows, but they face sideways to the board, facing out the window. I first have to totally remove 2 desks to make the rest fit. Then I make the rows about 2 feet apart. Each desk in a row touches the one directly in front of it. One outside row is butted up against my back wall, and the other is pushed right up against the board, a line of desk. So on test days, I don't use my board because I can't access it with the desk in front. This leaves just enough room for a small walkway at the front and back of the rows. Under the current plan, this is how my classroom would probably have to look every day. When we give the SAT and move the desks 3 feet apart, which is only half the recommended distance, we can fit around 18 desks in my room, again, if we go up against the board and walls. At the time school let out in the spring, I had 38 students scheduled for one section of AP American History for this upcoming school year. We were short-staffed and lacking classroom space before the pandemic, but we worked hard and we made the best of it. And given where our district falls on the per pupil funding compared to our neighboring districts, we all know we've always done more with less. But we are talking about putting up to 1,100 students under one roof for 6 hours a day in a time when outdoor gatherings are limited to 100 people. And as recent events have shown, even this is ineffective in preventing an outbreak. If Major League Baseball, with all of its money and resources, can't prevent outbreaks amongst 35 adults who work outdoors,
do we really think it's a good idea to put 1,100 teenagers inside together? And this is nothing against teenagers. I've willingly chosen a profession where I am around them all day. But you know teenagers, a lot of you have some at home right now. What is the actual likelihood those masks stay on properly all day? During the proposed extending passing time of 10 minutes, teachers will lock down their classrooms with themselves inside to sterilize all the desks in their face shields and gloves, and students will be unsupervised in the hallways. All the teachers will be in the classrooms cleaning. We've had 2 hall monitors, but I believe that the proposed budget cuts brought us down to 1 for the entire building. And you have to remember, if you remember being in high school during passing time, you know the students have found their friends and they are like clumping up. We've got a huge group of seniors that stand in front of the 3rd floor windows, another clump of underclassmen are in front of my 3,400 project studio. And I've got these early birds just standing en masse outside my door because they're clamoring to get in. They want to learn so badly. And this doesn't even get into the bathroom. Under normal circumstances, the line for the girls' bathroom is shoulder to shoulder out the door. Now students have sat in classrooms for 2 hours instead of 1. With social distancing, they will be wrapped up and down the hallway. But who is going to monitor the spacing? The teachers are still cleaning, not doing their normal hall duties. I know as an adult, it is sometimes hard to remember to stay 6 feet away from other people. And this is just a lot to ask of kids. So unless we can figure out a plan that allows for students to actually social distance, reopening is too risky. And if we don't have the staff and the infrastructure due to budget concerns to enact such a plan, then we simply cannot afford to reopen. We're at a place where it is not feasible to be safe and be in the building together, and that breaks my heart. Bottom line, we are all impatient to get back to normal. As teachers, we want it just as bad as the students and parents, but the reality of the situation is, under these circumstances, even going back to school face-to-face will not be normal, and at worst, deadly. My students will sit in crowded rows. They will not be allowed to get up. There will be no group work, gallery walks, activities, stations, conferences at my desk or at their desk, or in my case, historically theme parties. But these are the things that make teaching and learning worthwhile. Class will be lecture-based, and the only interactive group lessons will have to be completed digitally anyway. And that's in the unlikely event that we get the access to the Chromebooks by the start of school. I think we were trying to be optimistic with our plan to reopen face-to-face, but it's probably time to admit to ourselves that logistically, it is wishful thinking. I'm afraid opening in this way will likely cause an even greater spike in cases, and we will all be back remote learning by October anyway. But now we've risked students, staff, and teachers getting sick and bringing it home to their families. I know people are worried about the economic situation, and justly so. Childcare is an issue. But if enough schools go back in the state, we could end up in phase 3 again. And then where will we be? Think of the businesses that are going to have to shut back down and the people who will be back out of work. As teachers, we practice active shooter drills, and we prepare to put our lives on the line for our kids. But please don't ask me to put my life on the line when it can be prevented. Please don't endanger our students and their families. We can teach online until it's safe. It's not perfect, but we will work hard to do right by the kids in the community. We'll have more time to prepare than we did in the spring. Please don't ask us as teachers to choose between our students and our own families. In my mind, I keep coming back to, what if we lose someone? We have members of our staff with a myriad of underlying conditions, and not just our older members, young staff with underlying health conditions, people with elderly parents they take care of, pregnancies, newborns at home, and most of us cannot afford to not work or simply retire. We have no choice but to risk our lives if school reopens. And I can't imagine going to the funeral of a colleague, a students or family members knowing that this is something we could have avoided. So please put the safety of the community above all else in making your decision. Thank you for your time. I know that was a lot.
No, thank you for your comments and for your service to our district. Okay, next up is Andrew Sanders, and he's planning on calling in as well. Mr. Sanders, are you there? *6 to unmute. Okay, he did leave a comment, so I'll read the comment, and then if he joins us, I'll let him continue speaking. I would like to comment to you in writing that I support the opening of schools for in-person classes with proper safeguards. Our children need in-person instruction, otherwise they will fall behind in learning the skills they need to advance in their schooling. This is especially true for the younger students. Our children also need to attend school to continue to develop relationships and social skills. We also need children to attend school so that parents can work to provide for their children. Now that several months have gone by, we have a better understanding of COVID-19. It is not as deadly as some thought initially, and there is testing and treatment available to help people that are infected with COVID-19. We should not deny our children of the education they deserve. For older students, a partially remote option may be helpful, but in-person instruction is still needed for our children to be successful. Okay, Mr. Sanders, if you want to call back, you're also able to do that. Next is Jim Mikola, and he also plans on calling in to talk about online virtual learning concerns and questions.
Hi,
Hi.
This is Jim. Can you guys hear me okay? Thanks.
Yep, great.
Yeah, I have a son that's going to be a senior this year at South Lyon East High School, and I'm really leaning towards the online option for safety reasons. And I had some questions and some concerns on the online option. The first is when I go through the FAQ and look at the classes that will be taught by South Lyon teachers, there aren't really very many classes there that are applicable to the juniors and seniors. Really, there's just basic physics and English. There's no AP exam, AP level classes, no junior, senior level math, no higher level foreign languages, things like that. And I was really hoping to have more online classes taught by the teachers themselves because we have such great teachers. Now that being said, if we don't have that option, then the fact says we can take on, the children can take online courses through Edgenuity, and it does say or other options. And I don't know what the other options may be, but I'm hoping there are stuff like Michigan Virtual, which has been a online course provider for the South Lyon District students in the past. My own son took government last year through the online at Michigan Virtual because of scheduling conflicts. He couldn't get that class through South Lyon Teacher in the high school. Okay, but it doesn't really list what the other options are. So one of my concerns is, well, I'll be stuck with Ingenuity. And Ingenuity doesn't have as many classes. For example, they don't have advanced placement physics C. They don't have advanced placement macroeconomics. They don't have CAD. They don't have, some of the other classes that my child would normally be able to take through the South Lyon East High School curriculum. And so that has me concerned. And so that is kind of a question. Can we do like Michigan Virtual like we've done before? Now, if we can, that brings me to my next concern, which is grades, right? Because again, I really want to sign my son up for the online, but I don't want him to be at a disadvantage when it comes to the quality of his education or his ability to get into universities. Now he's going to be a senior, so really his fall semester will have a greater impact. But the transcript as a whole is taken into consideration by the colleges. And last year I mentioned the Michigan Virtual Government class. Well, that received a pass-fail grade. these organizations like Ingenuity and Michigan Virtual provide a completion score, a percentage from 0 to 100. But the school district has a policy where that's simply converted to pass-fail based upon a threshold. And pass-fail is not really competitive advantage when you're up against other kids who actually have a letter grade. Okay, so the difficulty of the curriculum is important, hence the desire for the AP classes and the advanced classes. And then the grade is desirable because that's how you're going to get assessed. The world's a competitive place. So that's kind of wrapping up my concerns there with online, or my questions. Hopefully, some of that information can come out in some further information releases by the school board. That'd be great. It's been a lot of information released so far. I really appreciate it. I have been listening to some of the comments, and there's some really valid concerns I'm hearing. And one thing I would recommend is checking out some of what the other school districts have put in place. I know the Lansing School District is all online, but they have a system they put in place for parents that are working that just cannot be at home with their children. So there are other things available. We don't have to reinvent the wheel. We can leverage some of the brain trust in our state and see what some of these other school districts have come up with, because there are some other good ideas out there that we could consider. Thank you for your time. Thanks.
Thank you. Up next is Jonathan Weinrob, Southline High School teacher. He states, I would like for you to look at what the Monroe district is using, a combination of remote learning, a learning lab, and a virtual school option. This is available on www.monroe.k12.us. The learning lab opportunity is where kids work in the school building on the remote curriculum while being able to maintain social distance. It would allow for parents with a true need to drop a student off at school, especially young ones or those with special needs. It seems like a blend of the best of everything for a time that is stacked with horrible choices. It helps parents who cannot stay at home with their kids due to work, and it protects all the other children and teachers as well. Again, look at their plan on their website. It is an excellently written document and plan. Next up is Elizabeth Ilch, and she plans on calling in to talk about concerns on lower elementary and virtual learning. Ms. Ilch? You can press *6 to unmute your phone. Okay, we can come back to her, or she can come back at the end of the meeting as well. Next up is Cassie. And she states, I work in a hospital and I have watched so many healthy people die a horrible death alone. It's horrible. I'm worried about my ability to balance work and my kids' education at the same time. However, I really worry about all of our lives. South Lyon has had a huge spike lately. We are all preparing for a second wave. I know this is going to be hard on everyone, but I think we need to pause and see what happens around us before we bring children to an unsafe learning space. COVID is very real and can kill a healthy person very quickly, not to mention older and sick individuals. I think we need to delay in-person learning. I hope you consider safety over convenience. Oh, Elizabeth Illich decided to just leave a comment. She states, since 80% of our community already voted that they would prefer in-person, please advise why we are now going back on that decision. Also, how are you providing technological support for families that don't have enough resources? And what are the expectations of working parents to support virtual learning? Jennifer states, I 100% support fully virtual learning for at least the beginning of the school year. While there is no solution that will serve everyone equally, the safest solution is virtual. Also worth noting that this board is not even able to meet in person, yet are deciding to send thousands of children to school 5 days per week. If it's not safe for the board, it's not safe for the kids. Kathy states, If all surrounding district schools around us are beginning with remote learning and South Lyon begins with in-person, do we want to be the experiment for our communities when our children and teachers begin getting sick and in the news? I would love my children to return to in-person, but my bigger fear is my children witnessing a death of a fellow student or beloved teacher. Kayla Early. I'm not sure what her comment was. She didn't leave it. So Kayla, you'll have to resubmit. Next is a concerned South Lyon teacher. Thank you to the Board of Education, Superintendent, and committee members for your hard work creating a return to school plan in these unprecedented times. As a veteran educator in the district, the beginning of the school year is always an exciting time full of new faces, ready to learn and welcome into our classrooms. Like most people, I would love to get back to the normal routine of back to school activities. But the reality is whether school returns in person or remotely this fall, neither will showcase our normal. Students returning to school in person will be wearing masks for 7 hours, sitting in one spot for hours at a time, and given minimum recess breaks. They will stay in a single classroom for the entire day, including for lunch and specials, while sitting as far away as possible from their friends and teachers. They will no longer be able to work in the group setting or come to the carpet for lessons or use shared classroom technology. In-person schooling will feel like a sterile environment instead of the usual warm, happy, and welcoming place kids have come to love. While remote learning is not ideal, it can be done well. More importantly, it can be done safely. Students must have their basic needs met before they can learn successfully, which according to Maslow's hierarchy of needs includes health, safety, and security, all of which we are risking on the current in-person learning path. The amount of daily new COVID-19 cases for Michigan are on the rise and have been since mid-June. On the news, there are multiple reports of schools closing down due to positive cases within hours or days of opening. Just today, Dr. Caldoun reported schools as a hotspot. Last week, Governor Whitmer reduced indoor gatherings to no more than 10 people, which directly contradicts the school setting. An article published yesterday named South Lyon and Fenton specifically as hotspots, citing more than 150 COVID-19 positive cases due to gatherings. It doesn't seem like best practice for a school district and board members to decide what's best for the health of their community members, but here we are, forced to do so. Given the current status of the COVID-19 virus in our area, it is clear that in-person learning is too high of a risk. It will only lead to more positive cases in the community due to large gatherings in a school environment, and even worse, sick students, staff, and family members. I am asking you all to please put the health and safety of our students, staff, and families at the forefront. The sooner we commit to a remote learning plan, the longer teachers have to prepare a robust online learning experience for our students. Please give us this time to prepare instead of risking the path of in-person learning, only to come to a quick halt within days or weeks. It is not a matter of if in-person learning will come to a halt, but when. Then it will once again leave students in a state of confusion, teachers scrambling to educate online, or even worse, a child or staff member in the hospital. Thank you for your time, consideration, and continued hard work for our South Lyon community. Lisa Sadicott is a parent who states, please address my safety concerns regarding middle school crowds. How can everyone return to school full time and keep 6 feet distance on the buses and during passing time? Will class sizes be reduced in order to allow for proper distance in class? What about lunch? Are they eating in the classroom? I am concerned that students will not adhere to the face covering for the entire day. Next up is Sherry Wild, and she would like to call in. Ms. Wild, are you on the line? You can press *6 to unmute yourself if you're online. Okay, Ms. Wild, you can either join us when you get on the line, or you can come at the end of the meeting as well. Jason Scott states, I would just like to say as a parent of an elementary student and a middle school student that we should be back in school full time come fall. Please don't allow teachers to overrule the overwhelming parental support to send our kids to school in September. A student who would rather remain nameless states, I'm going to be a senior at South Lyon High School. Going back to school in person rather than virtually will truly help most of the students, especially those with mental health issues. Learning online for me taught me nothing. Personally, I did less work in 1 week than I would have done in a day at school. Also, some of the classes that I will be taking are classes that I will definitely need to be in a classroom for and have some hands-on learning be available. And finally, I used to love school, but moving to it online has truly caused a lack of motivation and no interest in even thinking about my future. So please do not take school away from those who need it. Lynn Henry just represents the teachers. She did not leave a comment. And I think that's it for now. So with that, if anyone else would like to make a comment, or anyone that wasn't able to talk this time, there will be additional public comments at the end of the meeting. All right, with that, we will move to agenda item number 4, which is the return to school plan discussion. Mr. Archibald? I'm hoping someone's not talking with their mic muted because we can't hear anything.
All right, I'm back now.
Perfect. Okay, you're up.
That's okay. Again, before I start, I just want to take the opportunity to thank all of those who took the time to either call in or send in their comments. I believe many of them bring up some of the very legitimate and very valid points that we have been debating and discussing for several weeks. I think they identify on multiple sides, on both sides, if there are two sides, the many challenges that we're faced with. But above all, I want to commend folks for articulating in such a clear way on such an emotional topic, but in such a respectful manner. And so I thank them for that. President Hanshaw, this is my first study session with this group, and so I'd like to lay out for you what I had intended to work through tonight with our team, and if you want me to amend that, I can. What we started with was the July 20 presentation. We did that purposefully because knowing that we want to have a familiar document that either folks had seen, or if they hadn't, they had the full document. It is not our intention to go through that in its entirety, but to highlight some of the areas that have either been updated or revised since that July 20 presentation, and more specifically, to spend some time on some of the complications that we continue to work through on a daily basis. And at the end, I'll summarize with what would be a current recommendation if I were there today. We'll work through to get through it very quickly, but if you want me to amend any part of that, please let me know.
Nope, that sounds perfect. So go right ahead.
Okay. All
Thank
right.
you.
Thank you. And again, we've provided information, and I appreciated people acknowledging that in an initial update on July 13th, our frequently asked question document on the 17th, and updated again on the 31st, our board presentation on the 20th, and we have been responding to a steady flow of emails from community and staff, and that input has been enlightening, informing, and invaluable. There was a question earlier about the survey that went out recently. Much of the feedback, or some feedback, that I had received following the last presentation was that June survey was submitted at a time when we were in a different place, felt we were in a different place, and thought we were headed to a different place. And that if they had taken a similar survey under the current circumstances, their answers might be different. So we took the opportunity last week to craft a survey that in part would help us gauge the community's comfort with full in-person instruction. We also then took the opportunity, anticipating at some point we would be in a remote environment, to gauge some of the technology needs of some of our families in order to, between what families can provide and what the district can support, where we would be. So we will share much of that data coming up here shortly. Next slide, please. Tonight's presentation, again, I covered that a little bit, and in the third bullet, you'll see we'll work to focus on some of the complications that we are still facing. It is important to point out that for all the reasons stated and some not stated, we absolutely believe that the best place for our students is in our schools. It is what we do best. It is where our students learn best, and any recommendation or suggestion to the contrary is painful. But any we make, trust, will be felt to be necessary. Next slide, please. Our priorities, as we've worked through this, is to continue to focus on student and staff safety. It's a reasonable expectation for all. We use that phrase frequently, and it's something that we need to keep in the forefront of our mind. In addition is the consistency of our instructional delivery. I have heard repeatedly from folks the concern about moving from in-person to remote and back and forth based on whether it's quarantine students, quarantine staff, the health conditions within a building or within the district. Those are things that we cannot necessarily predict. We can anticipate that they're going to happen based on what we have witnessed throughout our own community. But again, our goal is to provide a consistent instructionally delivery model, as we know that's best for learning. One of my greatest concerns is our ability to fully staff our facilities. I think you heard it mentioned. Prior to this, and in our best days, filling all of our sub-need vacancies across all positions is an immense challenge, not for South Lyon, but for districts across our state. When we are confronted with staff members who are sick or need to be quarantined and unable to carry out their duties, I am concerned on what that will do on our ability to maintain any semblance of a meaningful instructional program. And then the academic return on investment, we will talk briefly on some of the expenses that we've incurred already and would anticipate to incur. So with that, and again, I would remind my cabinet colleagues to please move quickly through the old information to focus on that information that is new. So Lisa, I believe you're up next.
Good evening, Board of Education. We do want to just recap for the families that were unable to join us previously, a little bit about where we have our guidance coming from as we've worked through this as a district. So the governor did create a COVID-19 task force that included people from across the state, administrators, staff members, school district leaders, parents, students, and other community leaders as well. That group published the My Safe Schools, Michigan's 2021 Return to School Roadmap at the end of June. So we've had just a little bit over a month now to work with the requirements of what it would need to look like for us to open in person. And the My Safe Schools Roadmap was released in conjunction with an executive order that also explicitly names those requirements that are shared in the roadmap as well. Next slide, please. The roadmap is broken down into what instruction can or should look like at each of the phases. So in phases 1 through 3, as a reminder for our community, there can be no in-person instruction. It must be remote. That isn't a choice we get at those phases. In phase 4, you may have in-person instruction, but you must meet the stringent required safety protocols in order to open. And then in phase 5, you can open and the required safety protocols are relaxed a bit. And in phase 6, which is the closest return back to normal that we would have, it would be open with minimal safety requirements in place. And at the moment, we are in phase 4. Next slide, please. Next slide, please. Sorry, go back one more, Chester. I went too far ahead of myself. The guiding principles that the state used to inform the roadmap were equitable access to learning, and that being a right for every child. That it be a collaboration between parents, students, and teachers, and using data and evidence to prioritize resources for each child. That teachers and staff would prioritize relationships as they create those learning environments. And that teachers and staff would empower the value and cultivation of relationships and belonging of student and parent voice in all aspects of the learning process, including emotional support for families. The roadmap lays out requirements and recommendations in each of these categories: safety protocols, mental and social emotional well-being, instruction, and operations. There are some differences between what is required in the protocol and what is strongly recommended or just recommended. The safety protocols that are required have to be implemented in schools that serve students from pre-K through 12. These are the most feasible protocols with the minimal risk of exposure to COVID-19. Safety protocols that were either strongly recommended or recommended are optional, and schools may choose to implement those safety protocols to minimize the spread of COVID-19. And those may be appropriate in some settings, but they may not be appropriate or feasible in all settings, and it's up to local districts to determine how they would like to implement those. So just a reminder of what we need to submit. We do have to have our template into Oakland ISD by August 15th. We will be bringing a completed template to you Monday evening at the board meeting, the regularly scheduled board meeting. And then at that point, based on the decision Monday night, we would submit to Oakland schools. We have until the following Saturday, the 15th, to submit that. And then they would turn our plan into the state. So I'll be turning it over to Kristen Weber, who's one of our curriculum coordinators, and Kristen will speak to the community survey update.
Good evening, everybody. I wanted to give you an update on the community survey that we sent out on August 1st. As of last night at midnight, we had 5,295 students represented in the results. 2,700 of those students ranged in ages from preschool through 5th grade, and then 2,595 students represent our 6th through post-secondary students. Next slide. So this first graph shows you the results as a district on the comfort level with coming back to in-person instruction in phase 4 with the required protocols in place. Taking a look at the levels 1 and 2, which would indicate an uncomfort with returning to in-person instruction, that represents a combined total of 41.1% of our respondents. And our comfort level, so 4s and 5s, represents 41.1% of our respondents. So as you can see, they are equal on both sides. Next slide. Our second question dealt with the comfort level with remote learning, having a temporary start to the school year in a remote learning environment. In this graph, it shows you that there is a higher comfort level with starting in the remote environment for a temporary period of time. 32.1% of our respondents were uncomfortable with a remote start. That is our levels 1 and 2 in the survey results there. And 53.5% of our respondents were comfortable with a remote learning start to the school year. Next slide. The survey data here indicates a shift in sentiment among our community related to their comfort level with starting the school year in person in comparison to our June survey data. There is a greater comfort level with a temporary remote start to instruction among both elementary and secondary families when the data is disaggregated. 72% of our families have indicated that they have enough learning ready devices to start the school year until the district takes delivery of additional devices that were ordered on July 21st. And lastly, the district does have enough devices to support those students without learning ready devices of their own at this time. Right, and I will turn this over to Steve.
Chester, if you would please just flip through to about 3 or 4 slides to where it says roadmap phase 4 with masks, where you'll see a blue portion right there. Thank you. Back up one, please. Thank you. The blue section is a new piece, and as we know that wearing a mask is one of the leading precautions to mitigate the spread of the virus. We had not included this in the July 20 presentation, and after getting considerable feedback and quite honestly being asked why it is that we would not implement one of the strongly recommended portions of the roadmap when it would be a relatively simple addition, caused us to rethink that and add that. We certainly recognize, and I have a daughter who's a kindergarten teacher, we certainly recognize the challenge for anyone wearing masks, but let alone our little ones. But again, we have chosen to add this to in-person instruction at this point, again, as one of the leading precautions to help mitigate spread and to help keep our students and staff safe. Chester, if you would please move 2 slides. This is an additional part. It's been in our FAQ, but that parents of students who are medically unable to wear a face covering or unable to remove the face covering on their own can simply provide a medical note to their appropriate administrator, and they would be exempt from wearing a mask. So I know that was an important issue for many, and want to make sure that you would be aware of that exception. Next slide, please. The complications with masks, and again, we see it applied inconsistently throughout our community and throughout many communities, quite honestly. It's not just ours, but the failure to strictly follow facial covering protocols will undoubtedly increase the health risk for students and staff. Discipline, supervision related to mask wearing, it will take time away from instruction. We would anticipate, as there is increased demand, that to face supply chain issues and increased costs. You'll see in the last slide, we have currently ordered 85,000 masks in our operations department. We are yet to receive them all, yet they were ordered several weeks ago. That's at a cost of $31,200. While we anticipate that could be a 2-week to a month supply, it is actually quite difficult to know that right now without knowing exactly what staff or students will or won't provide their own mask. But as a district, we'll need to be prepared for anyone without a mask or with anyone whose mask becomes unusable during the course of the day to be able to provide one. So again, those are some of the complications with respect to the mask requirement, although we do believe they would be relatively easy with some additional routines and commitment of our families and staff and students to adhere to. And I'll turn it over to Sue Toth, who will pick up with hygiene.
Good evening. In phase 4, there are requirements and recommendations that we'll follow to reduce the spread of the virus. We'll teach and reinforce proper hygiene, such as coughing and sneezing etiquette, proper hand washing, keeping personal belongings separated, and limiting the use of shared items. The required hygiene supplies will be provided and cleaning protocols will be expected to be followed. Next slide, please. As we design the implementation of safe hygiene practices, complications arise. Monitoring proper hygiene consistently is a challenge. Hand washing every 2 to 3 hours is recommended, which will result in a loss of instructional time. While many of the supplies have already been purchased, more will be needed. With such a demand for hygiene supplies, it is expected that shortages will occur. Our district, as well as other districts, use the Oakland County Consortium for purchases. With so many districts being required to meet the hygiene specifications, it is likely that our district would not have the needed products. Should we need to order them from a vendor not on the consortium, the bidding process would be followed, taking up to 2 weeks to complete an order. It should also be noted that the financial impact of purchasing hygiene supplies is significant. Next slide, please. Our district is committed to working closely with the Oakland County Health and Human Services and to follow the required protocols for screening staff and students. Next slide, please. We are currently requiring all students participating in school-related activities such as band and music and athletics to use a screening tool that asks a series of questions prior to students participating. Staff are also required to submit a completed screening tool daily before reporting to work. When we return to school, staff will continue using the daily screening tool that is currently in place. Students will be screened daily at home by their parent or guardian. We have not yet received guidance from the health department on whether our return to school screening methods must include a daily temperature check in addition to the screener questions. Next slide, please. There are complications associated with screening students and staff. Some persons infected with COVID-19 are asymptomatic, which would result in persons passing the screening and attending school while being contagious. For staff members who have had close contact with a person who has tested positive for COVID-19, or for those who are experiencing symptoms of the disease, the expectation is that they will remain home for 14 days. Further, an onset of symptoms would make it challenging to cover classroom assignments with guest teachers on short notice. We'll continually reinforce the use of daily screeners, but we expect that the process could be easily forgotten, especially while new routines and habits are being formed. Another complication with the screenings is the difficulty of distinguishing between the symptoms of COVID-19 and other common illnesses. Next slide, please. Our intermediate school, Oakland Schools, has partnered with the Oakland County Health and Human Services to actually support our schools. The Oakland County Health Division's Communicable Disease Unit will be our point of contact, and is expected that they're going to work with us to provide a nurse for our district. While the details of the COVID school nurse program are still being developed, our district has developed a collecting and reporting system which meets the requirements of the roadmap. Next slide, please. While positive cases of COVID-19 are identified within our schools, there are many complications. Testing is currently robust and actually relatively easy to obtain. However, lab results can take several days to receive. Delayed testing complicates the contact tracing, which can impact the spread of the virus. Should a person test positive for COVID, they will be expected to isolate and refrain from coming to school. Those who spent more than 15 minutes with less than 6 feet in proximity will be expected to quarantine for 14 days under the current CDC guidelines. When a positive case is identified within our buildings, it is strongly recommended that the space in which there was an exposure be closed for up to 24 hours before cleaning. When a confirmed case of COVID-19 is identified, our district is required to collect and report information to the health department. Communications to impacted community members is also expected. These responses take staffing and resources to implement. Next slide, please. Recently, it has been reported that 50 residents of the 48178 zip code have tested positive for the COVID-19 within the last 30 days. It was reported that the 48178 zip code has had 138 positive coronavirus cases and 10 deaths since the pandemic began. Exposures at large community gatherings can lead to the spread of the virus within our schools. Should this occur, our ability to cover staffing vacancies would be very challenging, And without a doubt, this would impact the consistency of instruction for our students. I'll head back to Steve.
Thank you, Sue. Chester, please move one more slide. In part with athletics, I'll also take the opportunity to inform you that Sue Toth has been identified and agreed to serve as a sort of our COVID point person for the district. And so as we have identified cases, whether they're testing positive or exposure, Sue is working with the health department, working then with our staff, and making sure all the communications and things are happening in accordance to our protocols, and has been doing a fabulous job keeping up with things and getting informed and making sure that that we are on top of it. With respect to athletics, since July 10, and I just want to share one piece, and that is that what has also helped perhaps move my thinking a little bit is our athletics and activities have had a very strict protocol in place, which our ADs, coaches, and athletes have been following, as well as parents and communication. And it has been a very controlled environment, although we have had numerous incidents, I believe about 22 since July 10th of either positive or those being exposed. It's resulted in some closures of activities or shutdown of activities until we are able to follow up completely with the health department. And obviously a fair number of days of quarantine for individuals who have been impacted. Of those incidents, that includes roughly 30 individuals and 5 staff members. The advantage to what we've experienced this summer in athletics is that it has given us a very controlled opportunity to have protocols in place, to work through our processes. And again, I commend the principals, the athletic directors, the coaches, the athletes, and the parents who have been working through this all summer long. I think it suggests to me that incidents are not avoidable, and it stresses the importance of having a process in place in order to be able to respond to them, which I believe, at least in this regard, we've been able to do. It does make me worry, however, because I know, and Sue may reiterate, when we get a call on an incident, it will involve at least 3 or 4 staff members with the health department and with the impacted individuals, teams, and so forth, for the better part of a day while we are working behind the scenes to get everything communicated. I will be very candid and say that worries me when that transfers into an entire school environment. Again, with the MHSAA, we will continue to follow their guidelines. They put out some recent information on July 29th. They've approved a phased-in approach to athletics. They have eliminated scrimmages in all fall sports. Spectator guidelines have not come out yet. They've allowed low-risk sports such as golf, cross-country, tennis, or swimming to begin practice and competitions August 12th. However, pools remain closed. We've allowed moderate risk sports in soccer and volleyball to begin practices on August 12th. Competitions have been delayed, yet gyms remain closed. We have a delayed start for football, and decisions on competitions and potential further delays are forthcoming on or before August 20th. So I think, again, we will continue to follow the recommendations of the MHSAA, but the little bit that I just shared with you suggests that they continue to be in flux as they monitor the ever-changing situation as it pertains to athletics. I believe next up is Stacy, who will cover several areas in cleaning, transportation, and food, I believe. Stacy?
Good evening, board. I am not going to go through the the plan that we put on paper to meet the roadmap. So if you could fast forward 3 slides, Chester, please. Nothing changed from what our original plan was, but as we work through and try to logistically figure out how we are going to implement those plans physically to keep our staff and students and staff safe, we've uncovered many complications with that. First of all, with staffing for our custodians and cleaning the buildings, we would definitely just need more staff. The current staff we have now would be unable to meet what we're required to do on a daily basis. Like a public comment was said earlier, we are only staffed to clean elementary buildings every other day. It's not that we wouldn't want to hire new staff, but on a regular school year with no COVID-19 issues, we struggle filling custodial positions. That being said, another concern of ours for staffing is just for substitute teachers. We don't have substitute custodians. If we need to quarantine any of our custodians, the safety of the students and the staff are going to be at risk because we are not going to have the staff to properly clean that have been trained to clean the buildings that we need to be cleaned. It is a requirement of the roadmap for all desks to be cleaned in between every class transition. That goes to staffing. Again, we do not have the custodial staff to be in every classroom to clean every desk in between every transition for in the secondary schools. That it's an impossible task for our custodial staff to undertake, and we would have to enlist the help of students or teachers, which is not an ideal thing for that either. There's cleaning time restraints with all of that cleaning that's mandated in the roadmap. That's going to take time away from instructional minutes. We need time to clean those classrooms, which is going to have, it's just going to take away time from instruction and focus from instruction. Teachers aren't going to be able to focus on instruction when they're having to worry about, are the desks clean for the next students coming in? And it's a requirement of the roadmap that the cleaning must be monitored. Again, we don't have the staffing to monitor our custodians that they're doing it properly. So that's another complication that we've run into of logistically implementing the plan that we put on paper to follow the roadmap requirements. Next slide, please. We've also run into some challenges with supplies. The lead time for supplies that are being ordered are going to get later and later as the demand from schools, all bidding for, or all ordering from the same vendors, is going to get difficult. The increased costs for cleaning supplies are going to increase as the demand gets higher. The vendors that are approved by the consortium we would suspect are going to run out of supplies, since all of the schools are going to the speed up the ordering. Once those vendors on the consortiums are out of supplies, we're going to have to go through the bidding process to secure supplies and cleaning products. We're running into problems figuring out how are we going to distribute all of the cleaning supplies that are required to all of the classrooms in a timely manner and make sure that nobody ever runs out of what they need at any time. The costs, I mentioned this earlier, are going to continue to get greater with the demand of the supplies. And it is also required that we keep the cleaning supplies secure and stored away from any, from all in a secure place, which also complicates things, as we need to have those cleaning supplies in every single classroom in all of the secondary buildings for every single cleaning in between class periods. Though, Chester, if you could fast forward 1 slide. We didn't have any transportation updates on our plan. So I will go right into the complications with our implementing our transportation plan that aligns with the roadmap. We have ordered hand sanitizers for all of our buses, which came at a great cost, and we are installing those on our buses. However, we are again going to increase costs with those hand sanitizers. Monitoring to ensure students are wearing masks at all time on the bus is not something a bus driver can do. Every time a bus driver takes their eyes off the road, that's putting the children on the bus at more risk. We don't have the staff to put a monitor on the bus to make sure that the kids are wearing their masks and wearing them appropriately. We are going to have to increase the hours for the work for our bus drivers, because it is a requirement of the roadmap that between every route, the bus driver must thoroughly clean and disinfect the bus before they let any other kids on. That drivers with glasses, if anybody knows that wears glasses, when you put a mask on, your glasses fog up. So we have run into that complication on how are we going to protect our students getting on the bus, and how are we going to protect our bus drivers that have glasses and should be wearing a mask, and it's causing their glasses to fog up as they drive down the road. And again, with every other department and position in this district, we do not have sub bus drivers, and bus drivers are not easy to find, not alone in South Lyon, but everywhere in the state. Every district struggles with finding bus drivers. If we have to start quarantining bus drivers, we are not going to have the staff to fill in those bus drivers to get those students to and from school. Okay. If you could fast forward 4 slides, Chester, please. There is no updates with our plan. One more, please, Chester. Then the lunches from the previous presentation, but I am going to go over the complications that we've run into with implementing those plans that align with the roadmap. It is strongly suggested or recommended that we use classrooms for lunch spaces whenever we cannot social distance in the cafeteria. Staff are not able to remain in the classroom during the lunch break, as we are required to give them an additional lunch break. So we'll need to identify additional spaces where staff can eat lunch and remain socially distanced. Classrooms with students with food allergies have limitations on them and cannot be brought for snack. When lunches must be eaten in the classroom, those rules will apply to the lunches to the children that are bringing in, not just the snack. And to make a scheduled lunches work, they must begin earlier and they must end at a much later time, which means kids could be starting to get their lunch at 10:30 in the morning, shortly after they've gotten their breakfast. And some students might not be scheduled to eat lunch until right before they go home. And even with spreading out these lunches, we would not be able to maintain social distancing at all time. And as well as with our bus drivers, our teachers, our custodians, if we have to start quarantining food service staff, we do not have any extra food service staff, subs, guests to come in and step in and help us implement lunches and serving students. And I will turn it over to Kelly.
Good evening, everybody. I am going to talk through our social distancing, and while we haven't made any additions since the last time we shared, I am going to talk through the social distancing slides, because that is where a lot of the complications arise. So while staff members are working to maximize space as much as possible between individuals in the classroom, we recognize that maintaining 6 feet of 6 feet of distance is not feasible in many areas. In order to increase the space, we're going to be removing any additional classroom furniture that's not being used for function or for storage. And at secondary classrooms, we would be making use of both lab tables and student desks in science classrooms whenever possible. While we would work to face student workstations in the same direction in rooms where it is logistically feasible, we also recognize that that won't be possible in all classrooms. Another complication is that many of the classrooms in the district use tables rather than student desks, and social distancing and ensuring that student work areas face in the same direction in those situations would be a challenge. Due to the number of tables that we have in use in the district, it also isn't feasible to replace all student tables with individual student desks. And we also recognize that even when we have social distancing practices in place, students may still approach one another, share materials, see one another outside of the school day, and congregate in common spaces. Chester, if you could go forward 3 slides, please. So one additional measure from the slides that we shared on July 20th is that all drinking fountains will be turned off during phase 4. Students will be able to bring a water bottle from home, and if they need more water during the day, we would provide a disposable water bottle for them. So some of the complications that surfaced related to implementing the additional measures. The implementation and reinforcement of all of the additional procedures and requirements will disrupt the instructional day and compromise instructional consistency. It will also be difficult to support student feelings of emotional safety and well-being while still maintaining social distancing. The social aspects of the school experience will look very different than they would in a typical year. There are also increased costs associated with purchasing additional materials so that we would be able to limit students sharing materials. And even with those additional purchases, it's going to be difficult for us to fully restrict student contact with other students' materials. In phase 4, parents and families are not allowed in the buildings, and with restrictions on family members and guests who are able to enter the buildings, we would have to look at completely revising our elementary drop-off and pickup procedures. And while we're working to establish traffic flows within the school buildings and set up one direction, we also recognize that those patterns may not always be followed, and that entrances and hallways would still be busy during arrival, dismissal, and then during passing time as well at the secondary level. We mentioned that in phase 4, we would not have students share lockers, but we do not have enough lockers for each student to have their own. And we want to be able to provide adequate time to train staff on all of the new procedures and requirements and safety protocols before the start of school. There are also increased costs related to purchasing additional signage that would be needed to support things like proper hand hygiene, as well as increased costs of purchasing disposable water bottles for students since drinking fountains would not be in use. And I believe Lisa is taking these slides.
That's correct. Chester, you can jump ahead one more slide. One more. So we do want to share a little bit more about the remote learning models that we are working on with staff and with administration, because we know there are questions that came from the community about what that would look like. So again, I'm going to reiterate the same thing we shared last time. The spring plan was an emergency response plan. When we talk about remote learning and remote instruction, and we're talking about it for the fall, it looks very different than what families and students experienced in the spring. So for both the virtual pathway and a remote instructional plan for 2021, it calls for live instructional lessons with staff, graded assignments, and our normal level of rigor and depth. Students must be in attendance in order to be counted as attending school. And then that virtual pathway will share many of the same structures as the remote learning model as well. So for our elementary remote instruction, it's really a main focus is on building that rapport and the connections between the students and their classmates and the teachers. Balancing the amount of time we're asking young students to be engaged online with the time that they're able to do work offline. And then regularly making sure it matches the rigor and pace of our in-person instruction. We're building time across the week for students to have interventions and supports based on their individual needs. We're considering how much time can be asked of a student to be in a live lesson with their teacher and their peers based on their grade level. So you'll see that length of time may increase from lower elementary to upper elementary. We're working to support students in gaining independence and navigating the remote learning model. I was a mom of a junior kindergartner in the spring, and I'm a mom of a kindergartner coming into this fall. I understand it's difficult for them to navigate those classrooms on their own. So for elementary families, know that we are looking at a different classroom structure for the online model for our JK through second grade students so that it's a little easier for them to navigate that system independently. So we're going to work with them on building some independence and navigating through that remote classroom with a little bit less adult support. And then grading will be consistent with our traditional in-person instructional model as well. Our elementary remote instruction has that daily morning meeting. So in person, we would all be sitting on the carpet at the rug and the teacher would be talking with the class. If we come back in person, that's going to look like students sitting in desks in rows. It sounds funny to think about, but it will actually look closer to our normal with students in a virtual setting than if students were to come back in person. We would have those daily workshop blocks, reading, writing, math, science, and social studies, all rotating throughout the week. There would be daily read alouds, text talks, and math talks. There would be some asynchronous lessons built into the model. So families have asked, would we have to be live with our student for the full day? No, there would be points in the day where it would be important for your student to be live, but there's also some flexibility built into this model. So families could complete other portions of the day at times that work better for them. There are built-in breaks for movement, lunch, play, and snacks. There's daily specials time built in still, so still our art, music, and PE rotations, and then weekly small group instruction. At the secondary level, our students would still have their assigned class periods for their core courses and their electives. Students would meet live for portions of those class periods, and then the balance of that time would be independent work, group work, and small groups being able to meet with their teacher. Student assignments and assessments would still be graded, and a semester letter grade would be given, just like our traditional in-person instruction. And we are considering a block schedule for ease of students and staff working through in a remote setting. And Sue Toth, the Director of Special Education, will talk about what that looks like in our special education services.
Special education programs and services will be delivered remotely for students with special needs. Our special education staff will work collaboratively with our parents to address the challenges that may result from learning from home. It will be expected that the individualized education programs or their IEPs will be reviewed with the families to identify the present levels of students and to discuss how students have actually responded to the remote learning. The focus of our instruction will be to improve students' growth and progress toward their annual goals. Next slide, please. Special education staff will support students who need accommodated or adapted curriculum or materials. If there are supplemental aids or services that need to be added or changed to the special education case manager will work with the family to adjust the IEP. Special education staff will collaborate with teachers to provide specialized instruction in a manner that supports learning in the core subject areas. During remote instruction, children who are suspected of having a disability will be identified and evaluated through our child find process. Section 504 plans for students with disabilities will be implemented, reviewed, and adjusted as needed. I think it goes back to Lisa.
That's correct. So just to clarify for our families again, we are speaking about two different learning models that look fairly similar in particular parts of where we are with instruction. So remote learning is that temporary shift that either we decide as a district or the state decides we're back to phases 1 through 3. This is the plan where we assume that there will be some in-person instruction at some point, and remote is a temporary model that we are using in response to our district's situation. The virtual learning pathway is that planned full year that families would opt for if they know that they are not comfortable coming back if there is an in-person instruction. We are asking families at the elementary level to commit for a trimester at the elementary, which is around 11 weeks for the first trimester, and a semester for secondary, for middle school and high school. So families will not be able to move between those models outside of those times. And then I just want to reiterate, we want to make sure that those virtual classrooms have an opportunity to build those communities, those routines, that classroom culture. So it's important that if a family believes they will be opting for the virtual model, that they are doing that early on in this process. And we will be pushing out to families at the end of this week or the beginning of next week the option to sign up for that virtual learning pathway. And we will be closing that a handful of days later. So families should be watching for that, paying attention and respond back to that quickly, so that their students can be counted in that model if that is their plan. And Mr. Archibald, I believe we're back to you. Steve, you're on mute.
It's only meeting 407. I apologize. When the roadmap first came out and we had a chance to read the requirements, I, for one, I think was giddy, and I don't get giddy, if you know me, for the opportunity to bring students and staff back in person. We have been working, and I am new to these folks, and you know them better than I, but the community, the staff, and the administration has been working tirelessly to turn themselves inside out to make in-person instruction, to make remote, and to make virtual instruction work for the start of this school year. Again, I can't help but reiterate how proud I am to have joined that group. They are purely impressive. Not to mention everything that your community has, our community has commented about the quality of our teachers and staff. But the reality, as we pointed out by some of the complications, many of which are not insurmountable, but they will require more time to be able to address adequately to a level that I feel comfortable recommending that students and staff return safely. What you see on the slide there is a significant shift from our previous position that we had on the 20th. To a certain level, it feels like a failure that we have not been able to confidently uphold that position. But again, for the reasons that we have tried to articulate throughout the evening, I hope it's clear. We would, if I were making a recommendation today, it would be that we are in a fully remote start for a minimum of 6 weeks, that we continue monitoring our community health data, that we continue to monitor and work with the districts around us, and that we continue to work to mitigate the complications with respect to phase 4 in-person instruction, so that we, or that I am more comfortable recommending such. I would anticipate moving to full in-person instruction in phases. I reiterate to our staff, to our students, to our community, to anyone listening, we remain fully committed to in-person instruction. As I said earlier, it is what we do best. It is what we know is best for students. It is what we long for, without being too dramatic, more and more every single day. But I firmly believe jumping into it without having, we can put a plan on paper, but if we aren't able to execute it, and if we aren't able to execute it, I will take responsibility for that as well. But I do believe we can start with quality remote instruction and implement in phases in a much more controlled and manageable fashion that would be more likely to ensure success than starting fully in person. If the governor should move us back to phase 3, we would already be ahead of that and not have a shift to make. And again, we would work with our administration and our staff to continue to mitigate the complications we've shared with you and roll into or phase into in-person instruction in what I would believe would be a more manageable and obtainable method. And with that, it concludes our presentation, and we'll open up to questions or simply discussion between the board members, whatever you prefer.
Okay, thank you. That was a lot of information. Anyone want to start? Thoughts, comments, questions? Mr. Clark?
I'll start with a question.
Yep.
Mr. Archibald, has there been any consideration to rethinking or looking again at a hybrid model, which would provide a better opportunity for the social distancing if we return in person?
It's possible. We have not revisited that, Mr. Clark, with respect to the September 8th start. What our concern is instructionally is twofold. One is it requires our teachers to teach fully in a remote and in-person and virtual environment at the same time. It would assist with some of the social distancing. I'll be very honest and say too, as I've seen some of the plans in other districts, I'm having trouble adding up the numbers in terms of minutes of instruction. So while it is off the table currently, could it re-enter the conversation in some type of a phase in? That is possible.
Okay, and then my second question, if you don't mind, do you have, and I know this is very difficult, do you have any type of professional estimation of how many defections or losses we can expect in enrollment with families seeking alternatives if we choose just the virtual option?
I have no way of knowing, Mr. Clark, and to be completely honest with you, as neighboring districts indicated that they would be 5 days a week in person, was one of the driving factors that chose me to jump on that out of fear of losing students. And while that is a tremendous fear and would put us in an immense hardship, I believe I have a greater responsibility to run a district effectively. And while I would hope with a remote start and the confidence that our community has in us as a district, that they would stay with us, understanding our commitment to full person instruction. But again, I guess and again, I don't have a professional opinion or a professional number on that. Is it a concern? You know it is. We've had that conversation. But again, I am perhaps more moved right now for the safety of our staff and our students.
Okay, thank you.
Ms. Ortella?
I've got a couple questions. They're not necessarily related to each other. One of them was brought up by, I believe, one of the teachers during the public comment about, and I apologize, I don't remember the district where they're having a lab scenario where, parents who just don't have an option for kids because they're working, bring in, and you have a teacher where, you probably have minimal students at that point. Has something like that been looked at? And then the second question is, have you looked at or thought of what that phasing after the 6, 7, 8 weeks, whatever the case might be, might look like coming back to school for in person once we've kind of made it through that initial remote piece of it? How does the phasing look?
And any of my cabinet friends could join in. Mr. Tell, I think that district was Monroe. If I remember correctly from the question, we have not looked at that particular model, but certainly can. And with respect to the phase-in, it is, I don't have a solid plan on that, to be honest with you. We just got to this idea over the course of the last several days. But I would think whether we can start with a certain number of grade levels and build from there. And I don't know, and I'm just going to speak off the top of my head. For my first thought would be with the elementary level, if we were able to start there in some fashion, whether that was K5, K2, I don't know exactly, but with our added ability to cohort students, if we were able to do some things there with respect to the social distancing and so forth, perhaps we can start there and move up. But again, as we started to have the conversations, it varies in what we'd be able to do exactly. But we would have to have a more detailed plan.
Great, thank you.
Anybody else? Just unmute yourself if you would like to speak.
Yeah, so I hate everything about this, and I don't mean that to be critical of Steve. It's just the situation.
I share that with you, Mr. Dashner.
Yeah, if we go back to school full time, we put teachers at risk. I mean, most of our teachers are in an older age group, which are more likely to be impacted by COVID than the younger students that are in the classroom. There's no way for us to social distance. I mean, it stinks. And if we go full virtual, or no, not full virtual, I should say remote, then we're putting a tremendous hardship on parents that don't have the abilities to be home with their kids to walk them through the schooling, especially at the younger ages. So there is no win in any of this. Obviously doing both would be great, but there's just problem after problem that's in the way. And one of my biggest concerns is, and I know you're suggesting, here tonight, 6 weeks of remote, but I'm extremely worried that if we don't start the school year off in person and figure out how to live with this, is that we're not going to have a school year in person this year at all, because none of the problems that were presented tonight and that have been determined go away in 6 weeks. We still have the virus. We still have the risk of the virus. We still have risks of the safety of the teachers. We still have risk of supply shortages. We still have the difficulty of cleaning desks, monitoring cleaning, stuff that happens on transportation. None of that goes away. And I'm very worried that there's, the only logical endpoint for all of that is when either there's immunity, if that is such a thing, or if there's a vaccination that's available and people have the opportunity to get it. So I guess I would ask, and I don't expect an answer tonight because it's a big heady answer, but I would like to know what are the triggers for us starting to phase back and go to in-person school. Is that phase 5? Is it something else? And how are we going to handle the challenges at that time? Because those are all the same things that were brought up tonight have to be handled in order to go back at some point. So I know I'm being long-winded about it, but in order for me to back the direction, I need to understand how that decision is going to be made. Otherwise, I think it's 6 weeks and then 6 more weeks. And before we know it, we spent the whole year in a remote situation, hoping to get back to in person.
Thank you. Mr. Kennedy.
I think we need a phase 4.5, as Mr. Dashner mentioned, to how do we begin to phase back in when we can. I don't have any questions. I'm still getting my head around the detail and the diligence that Steve and the rest of our staff and our admin have worked through to get us to where we are. There's no doubt my child wants to go back to school. But having said that, I'm not a gambler. I tend to not be a risk taker, especially not with my sophomore, soon to be sophomore, especially not with anybody else's child. I believe one of the callers, Cassie, said we shouldn't sacrifice safety over convenience. Mr. Dashner said there's no win in this. And yes, it's an inconvenience for everybody all the way around, but we realize that I don't want to risk myself, nor my wife, nor my own kid, or anybody else to do everything possible. There's still too many unknowns. Number one, what's best for our student body. Number two, what's safe and best for our staff. And number three, of course, what's safe for the rest of us and all of our community. Those are the three things that we haven't completely addressed. We haven't completely figured it out yet. So thanks to Steve and the gang for putting the countless hours into this. I wish I had a solution or more questions or answers. And thanks, but I don't. Thanks to the almost 700 folks who are tuned in online. I guess tuned in is still a thing. To watch this, we appreciate their input and their concern. That's only 10% of our student population, though. That raises some other questions, but thanks.
Anyone else?
Are we just unmuting, Carrie? Oh, I'm
yeah.
sorry. Mr.
Yeah.
Clark, do you want to go ahead?
If I could jump in,
Yep.
and I don't want to like place myself on the opposite side of the scale from Mr. Kennedy, but I think we also have to realize that there are risks inherent in just living life. And, something that, I've had an aviation hobby and career since I was 17 years old. One of the things they teach you in aviation is you do everything possible to minimize your risk. And that is preparation, planning, training. And I think that at some point, we're going to have to jump in, like Mr. Dashner said, where do you start? And you don't learn to solve the problems unless you begin the operation. So we can take the ultimate caution, which everybody wants to do. But then if we did that, we would all never leave our house. We would never get exposed, but we also would never lead a life. So I think at some point, Mr. Dashner is correct. What's the point where we actually begin? Because if we don't have a starting point, we'll never get there. We'll never start. I truly do think that it's all about preparation. It's about training. It's about planning, having plans in place. Yeah, there's going to be stops and starts, but I think you're right, Craig, that this is going to be with us for a long time. And somewhere along the line, you have to begin, and you're going to learn in the process. So I'm reluctant to just toss away the thought of in-person education, because I think our students need it, our families need it, and we have to make it an option for those that choose it. And if you're uncomfortable, then you choose the virtual option. But I think we really have got to look at finding a way to start the process, or at least have a plan to get to the beginning point of the process. So that's my thoughts.
I don't, if I may just for a minute, I don't disagree with that at all, Mr. Clark. Do you yet think we're ready to take that first step? I think that first step is a really big step to open up fully. I'm not sure I'm gambling on that, to be completely
honest. I agree. That was why I brought the idea of the hybrid again, because that does allow for a little less density in the buildings, better distancing options for the students and the staff. And I understand the concerns of the teachers. I truly do. It is a concern. I mean, and I think I'm probably the oldest one here on the screen, so I get that concern. But I also haven't given up going through my everyday life. I just take all of the cautions that are practical and I think are necessary, and you just have to go with it. So I don't know. I think the hybrid we need to look at, but I'm reluctant to just make the decision and go to total virtual.
Mr. Bate? Yep, go for it, Mr. Bate.
I agree with a lot of what Mr. Clark and Mr. Dashner said. I think there is going to be a point, quite honestly, where we are going to need to get back. That's the place where we need to be for kids. I do have an issue with the risk argument. And I get where you're coming from, Mr. Clark, on that. But if we're using like the airplane analogy, if some of your mechanical equipment, particularly your safety equipment, was malfunctioning, you probably wouldn't take the plane up, right? I mean, you try to minimize risk, but you're not going to use it if you're going to crash it. And what we're looking at right now with in-person is that we've got some fundamental pieces that we might not be able to implement properly to safeguard our staff and our students. And if that's the case, then we're not necessarily minimizing risk. We're taking a more risky option. But I agree. I do think we need to get back at some point. For me, thinking about this, we start remote. It's not ideal. It's not really, it's It's not what any of us in education or any of the parents really think is going to be the best possible learning option for kids, but perhaps it buys us some time. And if you look at what's going on around us, our neighboring districts, and it's not that we need to follow suit or follow anybody else's lead. We're perfectly capable of making our own decisions. But this is kind of a unique situation where you see the shifting winds in these other districts where a lot of folks, I spent all day in Livonia today where they are planning to start remote as well. A lot of districts are going that way to at least start that way. I feel a little uncomfortable about making South Lyon the test case to, whereas before we were all thinking full speed ahead, we're going to come back in person and try to make it work. It's shifted in all these districts around us. I don't necessarily want to be the first one out of the chute, bringing everybody back and have that spotlight on us, because here's the deal. Infections are going to happen. This isn't an if, it is a when. We will have to quarantine. We will be interrupted. Every single district that goes back is going to experience an interruption. The question is how significant it is. Maybe it's a classroom, maybe you get it under control, maybe a whole school shuts down, but you will be interrupted. And I don't know if that serves us well to jump on that right away and to have those inevitable interruptions and to be the only people, going through that. I'd rather try to come back after we've had some time to sort this out and come back with everybody else around us and experience that kind of together. And to Mr. Dashner's point earlier about sort of what the metric is, I guess, for lack of a better term, for how we come back. I think there's going to need to be, we're going to need to grapple with some questions, some significant questions. We keep coming back to the staffing piece, for example, and we always say, like, somebody gets sick, we don't know if we can staff it. And then that just sort of floats away and everybody's like, oh, we'll figure it out. That isn't like we'll figure it out. That's a real thing. If you want your kids to come back to school and be in person in class, if your teacher goes out and we cannot fill it, and we're in that situation, in that moment, we're stuck. And that's a really significant problem. So I think until we can get our heads around that and get like a solid answer on how we're going to address that, we're not really bringing people back to the type of schooling that everybody wants them to have. So it's tough, though. It's really tough. I think it's worth considering. Last thing I'll say, it's worth considering what Randy brought up about the hybrid. Maybe we continue to have some conversation there. Mr. Archibald mentioned earlier, maybe it's worth talking about what we can do with the, with the K-5 grades, because maybe that would take some pressure off of families for childcare and so forth. If we feel like we could get some of the younger kids back sooner, it's worth continuing to have those conversations. But I definitely, I feel like it makes some sense to move with caution at this point.
Mr. Swigler, do you have any comments or questions?
Yes, I do, actually. Just a quick one. Somebody had mentioned earlier in the comments about some of the more advanced classes that they weren't able to take with Edgenuity. Are there proper classes already at the local community colleges that they could have if they did like a dual enrollment? Does that option exist for them to try to meet that need?
Go ahead, Ms. Kudwa, and then if I'll
Okay.
see if your answer matches mine.
We're working through right now with the high school administrative team to figure out, for the courses that aren't available through Edgenuity, what would be our preferred provider for that. So in a typical year, if a student chooses to take a course, we would call it a 21F course. If they choose to do one of the virtual vendors, they would have that catalog and they would look through it and decide which option they want. We're working very hard to have it be a situation where if there are 5 students from South Lyon High School who all wanted the same course and we don't have enough staff to run it with just 5 students in it for a virtual section, and maybe there's 2 more from East, that at least they might all be enrolled in the same one, so that they still have classmates that are from our district that they can work through the content with together. So doing our best to still give them a sense of a classroom culture, a sense of a community, peers to work with, correct? So they are looking right now at those course offerings from other vendors to figure out what do we feel matches best with our philosophy and our stance on how we would approach that content. And then they will be providing early next week families with what those options are.
Okay, thank you.
I have a question related to that. If someone chooses the virtual and you come up with a new plan, and then they decide to come back second semester, how would that work?
They can do that. It might not be a perfect match for what's taught in each semester locally versus in the online vendor option. But we have students who come to us at the semester right now anyway. It's the cleanest break point. We can make
Okay.
it work. So we're committed to doing that. So even if you enroll in the fully virtual option, some of your courses are with Edgenuity, we're enrolling you for the semester, not for the year. So if you choose to come back in person second semester, you have that option.
And the G grades, are we working to correct that as well?
So we need to, policy was not yet meeting, and with Mr. Kirby employed now with another school district, it will be happening. We'll be bringing that to you in one of the next couple board meetings and asking you to change that board policy so that those G grades would count as letter grades and then count within the GPA as well too. So we are working on that. That just was not the top priority. This plan that we've presented tonight is what needed to happen first.
Okay. Sorry,
And,
just I go back.
Yep, no, that's fine. One of the questions I had when it comes to a student that has tested positive and they quarantine for 14 days, if they have siblings enrolled into the district, do those siblings automatically have to quarantine with them? Or do they only get quarantined if they show up sick?
Well, it depends on exposure, and I'll ask Sue to join us quick because we've had quite a baptism by fire on what exactly exposure is. So, Sue, do you want to tackle that one for us?
Sure. So if you think of that close contact, that's how that exposure is determined. If they're having 15 minutes in a small space, 6 feet or under, that's the exposure piece. So if a person has had that exposure to someone who's COVID positive, they would be expected to be quarantined.
So every sibling basically would almost certainly meet that. Which yet makes it even more challenging to go full remote because, not to debate what happened, but with the recent boom in cases that have hit the district, that kind of gives you a microcosm of what's going to happen, I think, if we go to school right now. You have a concentrated group of kids all in a small space, and if one person has it, all of a sudden 50 have it. And listen, I want my kids in the school like everybody else. I really do. And we're struggling in our own household with that decision. But I think that was just real eye-opening. And it just happened a couple of weeks ago. So I guess to that point, I know we can't really share medical data, but is somebody tracking how severely impacted those that were in connection with those events of the last couple of weeks? Just to kind of learn a little bit more about how to react to that kind of situation should it happen when we do open up or if we do?
Sue is tracking those individuals in our district who are directly impacted. She is also in pretty regular conversation with Kaylee, the epidemiologist from Kaylee Blaney, the epidemiologist from the Oakland County Health Department. She's probably real excited I gave her name out. But she has been our main contact, and I think, as it is our expectation, although the Oakland County Health Department has not shared its student and staff protocols yet for districts, that as they are doing their tracing, and if they had recommendations for us as a district, that they would be contacting us and sharing that information and those recommendations with us. Because obviously we only know who's impacted, who are our students or staff. They'll have all that additional contact information.
And I guess I'll just leave it with this. I know for me personally, when you look at the district as a whole, you look at the reports that we saw today, it's extremely divided in everyone's comfort level and what they want. For me, when we do try to get kids back into school, I like a phased-in approach, and I'd really like to make sure that it is those students who need the most help, those lower elementaries, those with IEPs, maybe those who just don't have a real conducive learning environment at home. There's going to be plenty of families where if we had to stay remote the whole year, they'll probably make sure their kids will be fine. They won't fall behind, but it's the other kids I really worry about. So even if we don't get to go full in person for every student in the district this year, I'd at least like to see a push to get those with the most need in as quickly as possible. And maybe that would provide us some of those spacing requirements we need. But I know that there's logistics and stresses on staffing, but that's for me what I'd like to see as we kind of push through this. And that's all I have.
Okay. I just had a couple of comments. Like Mr. Swagler said, just recently we've had a number, 50 students. So we know for a fact that it does spread easily and quickly amongst teenagers. For a long time, we weren't sure that was the case, but we've proven it on one of the first couple weeks they've been hanging out. I think one of the benefits of starting remotely is that you are teaching the entire district out of the gate how to do it remotely. So all the students, all the staff, everyone will be trained and they will learn how to do that so that when we do go back into in-person learning, if we have to be shifting back and forth, we won't be having to then teach the students how to do remote learning in the middle of a semester. They will already know, they will already be used to it. Like Mr. Clark said, he doesn't go flying without a plan. We were given this roadmap a month ago. I think trying to come up with an entire plan for an entire district, 2 entire plans for an entire district in less than a month is not enough time. I think we need more time. And I think in order to have a good plan to mitigate all risks, that we should start remotely and use that time to come up with a more solid plan, a better plan to handle all of these concerns that we know. And honestly, I'm sure we're going to have more concerns that pop up. I like the idea of phasing in once we do have better plans in place. And I also agree with Mr. Schwegler, starting with the most at-risk students, the younger students who need the daycare, they would be the great ones to start back with. I personally have an incoming freshman with an IEP whose main goal on her IEP is socialization. So keeping her home is not my goal. It's the opposite of what her education should be like. But I also don't feel that her safety or the safety of her staff, the staff that would be teaching her, putting them at risk at this time, I'm not confident with it. So I think that's my last comment for now. Anyone else have anything else? Mr. Clark?
Well, Mr. Abate, you got your hand up first. Go ahead.
Oh, that's all right. Well, okay. Thanks, Mr. Clark. I think Carrie and Dan, you make an interesting point about bringing certain students back. I wonder if that's worth some further conversation. I know we had some conversation in Livonia. Our special ed department is thinking about potentially bringing back like our center-based programs for in-person, because they'd be the only group in the building. And some of those kids really must have that personal contact. So there'd be a much easier means of helping them distance and really doing what the CDC guidelines call for and getting them what they need. So maybe that'd be worth some additional conversation about those groups potentially being in person if we possibly can. And then I know that this is hypothetical because we haven't really been through this situation before and we just have some guidelines, but I'm trying to kind of get my head around the scenarios when we have a positive case or we have a symptomatic kid or so forth. So if are we essentially going to need to track down? So let's say a kid we have a block schedule, kid's going to go to 3 hours that day, right? He's in his class, goes to lunch, goes to another class, bounces around to several rooms. Are we looking at having to pinpoint everybody who was within a certain distance for a certain period of time in each one of those rooms, in the cafeteria, et cetera, and quarantine every one of those people? Is that kind of the situation that we'll be in?
Sue, you can join me on this one, but what we have been doing with athletics is trying to pin down the last time that individual was in contact with students. And I believe, and Sue, you can correct me when I'm wrong, when we share that information with the health department, they then are maybe going back an additional couple days from that contact, depending on when the student was symptomatic or whether we're talking about an exposure case or somebody testing positive. So the timing of when it occurs and to what extent. Can you me or add to that?
So that is correct. We're using the guidelines that the CDC have right now with that close contact piece. And that's really what's driving that whole piece, is that when they're that close, that's how it's being contracted. Now, during most of the time, our students are going to be having to wear masks. So that helps to reduce, and I'm sure that the health department would take that into account to determine what actions that we should take. But potentially, if just trying to make sure that the people who have been exposed are again quarantined and they can watch for symptoms as well, as it doesn't continue to spread.
So you could have a single student essentially interrupt multiple classes and students from multiple classes.
And I believe it would depend, based on what we've learned so far, whether that individual is someone who has been exposed or they're someone who's tested positive. If they're someone who has tested positive, they're a greater risk because they can expose others than if they've simply, and I say simply, if they've just been exposed.
Yeah, that makes sense. And then just one last thing, if from a teacher's perspective, particularly maybe an elementary teacher where you're kind of, you are maybe a little closer to kids, there's more of that contact than you might have in like an AP history class in high school and so forth. Teacher comes down with COVID, right? Are we looking at shutting down an entire classroom?
It is very possible, depending on, and again, all of these are situation dependent.
Right.
Right. But it's possible if that individual was deemed to be positive or contagious and exposed the entire class, then yes, that entire group would need to be quarantined for 14 days. But again, it is all case dependent, and that's why when we've had these cases come up, our folks have been excellent about communicating with us. They're aware of what information we need and get to the health department as soon as we can, and then take that lead. So, but again, it's case dependent.
All right, thank you.
Could the rest of the class all just go take a test, and if they were come back negative, then they wouldn't have to be quarantined, or you can't take the test within that time period?
Yeah. No, once, and it's again, so you can correct me if I'm wrong. Once you've been exposed, the guideline is the 14-day quarantine, because your exposure, when that may surface, is different. So again, it's the 14-day quarantine as opposed to a negative test. Sue, am I correct?
You are correct with that. So you're watching for those symptoms and not necessarily having to go have the test. So you remain quarantined for those 14 days, monitor symptoms, and then be able to return if you can still pass the screeners. But you could test negative and then within 3 days later come back as positive.
Okay.
I also do want to add the requirement, if we do have somebody that tests positive, that area of where they were at, so a classroom, does have to remain vacant for 24 hours before we're even able to get custodians in to clean that classroom. So even if the health department didn't identify those kids as being exposed, that classroom still has to be vacated if there was a positive confirmed in that classroom for 24 hours before cleaning. Am I correct, Sue?
I believe that's a highly recommended.
Okay.
And that's the same for anywhere. If we have students who we need to quarantine during the day in school because of symptoms, it's strongly recommended that we leave that area vacant to allow any air particles or whatnot to settle before they're clean. But again, I'll caution and I'll thank Sue for doing such a tremendous job of trying to stay on top of this for us, that none of us are medical professionals, and nor should we try to be, and that we work to get the information to the health department, the local health department, and go from there.
I do have a question regarding, call it either remote or virtual learning. Given that the virus is out in the community and it's still going to be out in the community, and I doubt that any of us are purely shut in to where we're not possibly exposed to it someplace. What happens if a teacher does get COVID with no contact to the school? Are we going to be able to find subs that are able to teach in a remote and or virtual environment to fill in for them, especially if it turns into a 14-day situation where they are ill and can't do the job?
Yeah. No, Mr. Dashner, I think that is a very good question. I would draw on our experience from the spring and my experience in a previous district that we had very few, if any, issues with being able to, with staffing or personnel issues in the spring. And that was at a pretty highly volatile time. So maybe we still have to confront that, absolutely. But it was not an issue for us in the spring. I don't know what it was like here in South Lyon.
And I guess one other thing I would share, just because in my work I've had experience with COVID in positive cases. We've had people that have been exposed to people that have been confirmed positive. The first time or two when it happened, it was a hassle of trying to figure out, okay, what's the process? How do we determine what to do and all of that stuff? It's gotten to the point now where it's pretty routine. I just had somebody get exposed to a confirmed positive last week, and I've got a job site where there's numerous people positive. Even after that, I had my employees stay home. They've tested negative. They made the 72 hours. And I understand the fear over the virus, but we also had another employee that went camping over the weekend, shared glasses with somebody. 2 days later, her friend's got a test, she's positive, and she ended up not getting it. So even when they were sharing spit, well, I shouldn't say sharing spit, but when they were when they were touching things to their mouth that they were sharing, it didn't even transmit then. So this is a big scary thing because there's so many unknowns, but at the same token, I don't know. It's not like it's jumping all over the place and grabbing everybody. I mean, our current total in the community right now is 0.2% of the people are impacted with it. And that's all the zip codes that go to our school. So, I mean, you're talking about 1 in every 646 people. If we had everyone in school right now and they followed that same percentage, it'd be 15 people. Now, I look at that and that's a lot. And yeah, that's something to worry about. But again, I go back to, I'm not saying we have to start in person, Steve, and I do appreciate all the work you've put in, everyone else that's worked on this, but I definitely like to know the plan for what's the measurement of when we start back, and all of these problems that we have now that seem insurmountable, how are we going to fix them? We either have to figure that out, or at that point, I don't know if there's any reason to have remote and virtual, because if you're doing it for the whole year, they're the same thing.
Thank you.
Okay, I stand in line here. What's the procedure for Monday evening, Steve? You're going to present one plan and ask for approval? Are you going to have multiple options? What's it going to look like that you're looking to do?
Right now, my intent would be to bring one plan to you for approval.
Do you think it would be advisable to have an alternative?
Well, if you don't approve of that one, yes. And I don't mean to be sarcastic, but that is part of the reason why we've had the conversation, why we've done the sessions we have, and why we're having the working session tonight, so that we could get a opportunity. I certainly don't want to bring to the board anything that isn't likely to pass. I respect your right to vote it down if you don't approve of it. But again, the issue with multiple plans continues to be dividing the efforts of what we're trying to do. So that's part of what I was hoping to get from tonight, was some direction from the board in terms of a single plan.
Well, I guess my comments are kind of reflective of what I've been hearing from my parent comments, which is, or parents commenting to me, which is they're looking for an alternative of just virtual learning. So I guess that, half of those surveys indicated that, our families were looking for some type of in-school or in-person learning. So I think it behooves us to at least have something in the back pocket that we need to pull out, because I think we've got quite a few members of our community that are looking for that.
I agree with you, Mr. Clark, but I actually think that most of those families are looking for 5 full days. Most of those people are working parents who are looking for somewhere for their kids to go 5 full days. And I don't think a hybrid is going to satisfy that need. And not many of them, it's people who need working parents.
Well, that's true. Some of them are, some of them have indicated as such, but,
Right.
I think that,
So,
I've just tossing out some ideas that we may not be just set in stone and have just one path to choose.
okay. Mr. Tell?
Yeah, I just had a question come in that I guess is was in my head but didn't think to talk about earlier is if we went to the first 4, 6, 8 weeks of the virtual learning for the secondary, middle school, and high school, how would the students' classes look? Has it been looked at in that detail in terms of would they still have 6 different hours every day that they're logging into a classroom, or do they have each day is assigned a class, whether it's okay, Monday you're going to be in your science and language class, Tuesday it's going to be this, or are you trying to, is the intention to try to make it look like a regular class day where you have your hour of biology, your hour of history, your hour of special or elective, your hour of math, etc. Has any kind of detail been looked at that for this 6 week of virtual? And then when you go back into the classroom, you're sort of transitioning, and as opposed to seeing your teacher on the screen, you're seeing your teacher in person, but it's kind of the same daily look.
And Ms. Kudwa can correct me if I'm misspeaking, but I think our goal would be to have our remote schedule and our in-person schedule in phase 4 mirror each other to make for a smooth transition.
Okay, thank you.
I'm going to jump in with one more question. One of the concerns I have with either virtual or remote is, I'll back up a half a step. I know our special education students with the IEPs, they're going to get supports they need per their plans. I can also see a segment of our population struggling with an online format that aren't special education students, that don't have IEPs, that might not have a disability, but they just struggle with the virtual environment and not being in person. Is there any plan for any type of supports for those students that aren't, IEP students that might need a little extra help through all of this?
I'll let Sue jump in there.
That's a good question. And obviously we do have students who need more than being able to be just remote. So I think of students, for example, who have physical therapy. It's really difficult to do physical therapy remotely. So definitely have a plan in the works of identifying ways that we can bring students back. We've got students, one of our parents had mentioned, was in the middle of an evaluation for special education. We need to get back to those. With the ability to still bring students into school, since we're in phase 4, we do have the ability to bring smaller groups in to be able to adapt and meet those needs of the students with special needs. It has not been thought out, though, beyond just those smaller individual students and testing and types of things like physical therapy.
if I might jump in for a second, just to circle back a minute ago, just Craig, if it's at all helpful, you had mentioned about subbing in the remote setting. It can be a little bit easier. It's not ideal for staff because each staff member is busy with their own classes, but it can be a little bit easier in that setting for departments, for example, of our full-time staff to lean on one another. So like if my teaching colleague in social studies, if we're both in person there and he goes out, I can't really jump across the hall and take care of his class. But if we're virtual and we're teaching the same things, I can gain access to that class list and provide the materials and pick that up as a means of kind of helping my colleague out. It's not, teachers don't love it, obviously, but it's a way, it can be a little easier than trying to fill the in-person vacancy, if that's at all helpful.
Any more questions, comments? Okay, we currently have 39 public comments coming up next. So why don't we take a 10-minute break and come back at 9:40, and we will then finish up with public comments. If everyone's okay with that? All right, see you at 9:40. We start with the public comment. Just to reiterate, we are not voting tonight. This is just a study session. It was just an opportunity for the board office to update us on their current thoughts of a plan. We will be voting on Monday, next Monday, August 10th at our 7 o'clock meeting that night. We appreciate all the comments and questions, and I think everyone agrees that we are trying to do what's best for everyone. We understand that not everyone's going to like it, but everyone is definitely working their best, and I do appreciate everyone's comments, questions, and all of the work of our staff. So with that, I will start with public comments. And again, it's *6 to unmute when it's your turn to speak, and I will begin. First up is Jill Manugian, and she states, returning to in-person learning as a nurse in a local doctor's office in our community, I have been working hard and trying to help our community throughout this pandemic. This is very real and scary times. I understand that. I have a 4-year-old excited to start real school in September. He goes to a local daycare and loves being around kids since daycares are open and functioning, and most have bachelors in early childhood education. They have done their best in these times to take extra safety precautions. They do temperature checks, screening questions daily. The staff wears masks and the kids do not, as asking 4-year-olds to do this for 7 hours is outrageous, but that's another conversation. They do cleanings and the kids still interact. They do not social distance. We haven't had one case of COVID yet. It's bound to happen, but has not yet. Teachers nor kids, and also summer camp school-age kids are there. In-person learning is essential for learning at a young age, even in the older ages. Let's be creative, teach outside if weather permits, flip-flop summer to bring off December, January, and February. We can do things to make this work. Get proper PPE for teachers, but not going to school and not allowing families to go to work because they have to watch their kids and be a teacher is unreasonable. Maybe teachers that are older or have underlying health issues should be the online teachers versus the ones in person. Some kids will do the virtual option, lessening up the amount of kids in school to help encourage distancing. Or if older kids can do virtual learning effectively, then do it and let elementary and middle schools go. Let's remember also COVID is here, unfortunately, forever. It's not going anywhere. If we do virtual now, then does that mean it will be that way forever? Because if you're scared now, it won't change in a year. Vaccine or not, it will always be a risk. I say go back to in-person because if we don't, we might as well dissolve public schools, which will be so sad. Many teachers will be laid off due to lack of funding. Say we take some safety precautions and do this. Parents that can or want to are keeping their kids home. Let's give the kids, especially the younger ones, a chance to learn in person. Thanks. Love, a concerned parent and nurse. Sherry Wild. She's a parent and bus driver. I am a school bus driver and a mom of 4 elementary children at Salem Elementary. While I understand this is an impossible situation, I have concerns about the current in-person plan. We currently are telling the kids they will not be allowed to interact with the other kids from other classrooms while at school. However, we will put them on buses altogether. Currently, there is no distancing on the buses. I just want to explain what it would look like on my bus on a daily basis. I currently drive for 2 different elementary schools with no minutes between when one school gets off and the next pickup begins. But I will now have to sanitize between each school. Once the children board on almost every day, I have 3 kids to a seat in every single row. Now, most people have said, what about parents driving? Well, there are maybe parents that can drive their children. I drive for a lower income neighborhood that just won't be able to do that. So the bus will most likely be just as crowded as ever. Therefore, there will be no opportunity for distancing on the bus. So what will be the point of keeping the kids away from each other at school just to put them on the bus together? Another note being that how can we afford to spread the classes out to more buses? We already have a shortage of drivers and a lack of funding for drivers. How can we feasibly do this? As a parent and a main income for my family, it is imperative that we have answers to this soon. I need to know if I will have a job in a month, and if not, I need to know so I can search for something else and be allowed to file for unemployment if possible. Thank you for your time. Next is Jacqueline Cherry, and she would like to talk about concerns with going back to school. Ms. Cherry, are you online?
Hi.
Yep,
Yep.
go for it.
Can you hear me?
Yep.
Okay. So I had this whole thing written out and I had all my bulleted points and now I've like feverishly been changing them. So I'm gonna run through my points as quick as I can and I hope that they make sense and whatnot. But I thank you all for considering this and I thank the leadership for recommending this remote start. Most important, first of all, Jacqueline Cherry, English teacher at South Lyon East. This is going to be my 13th year in South Lyon. I also am a mom to an incoming 3rd grader and a preschooler over in Farmington Hills. So I know both sides of this very much. But one, I'm worried about if we were to do in person, the amount of time we will lose when we have to do these starts and stops and back and forth. One of the things that I think that a remote start will offer that the other options do not is consistency. Maybe it's not the most favorable, but it will give us that chance to prepare, to put things together. As teachers, we can kind of, get some semblance of a plan here, and it will also give us some time to figure out some of these questions if they are answerable. I really do hope that we can get creative and work with the community to serve all those families with true need and monitor those kids that are at risk. Being in the district for 12 going on 13 years, I'm confident we have creative minds and we will come up with something. None of us want to be in a virtual situation, teachers, staff, administration. So we will come up with things and we will come up with creative solutions. To the point about substitutes, I've already had my regulars calling me and saying that if it's in person, they won't be able to cover for me. And then, let me see here, I'm skimming over my notes here. I think that 6 weeks is a good amount of time to reevaluate and to come back to that. I really, we can't, to the aviation comment here, we can't fly the plane while we're building it. So if we give ourselves some more time to kind of put some things together and put them in place, all of us want to go back to face-to-face. So I can't imagine like the fear that we will just stay in a virtual option forever. We've got too many people that want something completely different. So we will come up with something different. So I thank you for your time. Thank you for listening. I hope that we can come to a solution that works for everyone the best that it can. Thank you.
Thanks for your comment and your service to the district. Next is Leanne, and she represents parents and students. She states, teachers are essential like all others in the community. School in person needs to be available for those students counting on an education in person. Let those willing to be virtual, both teachers and students, be virtual. Pay those teachers less. Let those willing to go in person go and hire teachers willing teach and pay them more. Credentials might be slightly compromised, as many homeschooling now anyway. If not enough students per teacher is virtual, I'm sorry, but taxpayer money should not secure them a job, just like all other essentials. Make it possible for people to make their own risk to attend, and if not, then possibly no job. Drug use will take more lives if kids are forced to be unsupervised at a computer. Over 80% counts on teachers to be there. It is not changed. Answers will not be different. That 80% community pays taxes. Give jobs to those who deserve it. All companies hiring those willing schools can do the same to work for future of kids. Parents around willing to teach for short term and fill in and be paid what those teachers not willing to go. Take that survey. Next is a concerned teacher. And they state, good evening and thanks to all for being here and listening on behalf of our students. I am concerned that many parents do not understand the reality of what face-to-face school will entail in the upcoming month. I absolutely love my job, my lower L students, and the beginning of a new year. However, school will not be anywhere near what our families expect. Kids will not be able to interact with their friends, will not be able to leave their seats for brain breaks, will not have recess with other grade level peers outside of their classroom, will eat lunch at their desks, and will not get the love, care, and usual physical interactions that they thrive on each day. It breaks my heart that virtual learning may be a reality again, but it is truly what's the safest and smartest option, as to not allow for heavy community-wide spread. I hope we can make a decision to start the year virtually and reassess the state of COVID at some point, with a goal of returning to normal school sooner rather than later. Parents, I'm sorry this is a burden on you. It will be hard, but worth it if we can return to learning at some point later in the year. South Lyon simply does not have the funds to make this year safe for students, teachers, and families. I look forward to the day when I can give my students the attention, care, and true learning they deserve. Thank you for your time. A working parent states, I'd like to ask those teachers who called in and feel so unsafe how often they've been to Target, Kroger, Costco during this time. Our own governor was recently in South Lyon during this increased outbreak. So how bad can it be? I too, a working parent, have been exposed and endangered this entire time. Having to quit my job to support virtual learning, now I'm putting my kids at risk of not meeting their basic needs. There is no win-win. If there are families concerned, they can have the virtual option. If there are teachers concerned, they can be put on the virtual plan or tutoring or move districts. But now you are asking for hundreds of thousands of people to quit or endanger their jobs and families because a select few feel unsafe. Someone mentioned looking at other districts like Flint and Monroe. I think that's smart instead of calling fully virtual. Miss Christy Metelka, are you on the line? Yes,
I am here. Can you hear me?
Yes, go ahead.
Thank you all for taking the public comments, even at this late hour. We moved to South Lyon 2 years ago, and we took a long time selecting our home in a community to live in for the duration of our children's education. We have an incoming second grader and a new kindergarten that's really excited to go to school at Salem Elementary. My spouse and I are active in the PTO. We're committed to our public schools. However, our first responsibility is to our children, their development as human beings, as well as their safety and education. I implore the board to use science as the basis for decision-making regarding the educational model that South Lyon follows this school year. Feelings and politics should not be a primary reason for developing a plan for schooling. There's a lot of attention paid to low numbers of infected people in a population, how that death rate is really low. But has anybody done the math and expanded that number across our population? So how many students are we willing to lose? And how many teachers are we willing to lose? My spouse and I did the math a few weeks ago based on these numbers. So which students, 13 students, are you willing to look at in those yearbooks and sacrifice? Which one or two teachers are worth the sacrifice for all of the in-person learning? I appreciate the airplane analogy to make sense of this really complicated issue, but we're talking about a biological entity that is new to our species. So take your plane. It's like flying a plane that has brand new systems, safety protocols that are still in flux, and the result of your flight plan won't be known for a couple of weeks. So would you still fly that plane if you followed all of the safety protocols? but an elderly or immunocompromised loved one in your family, in your community, died 2 to 3 weeks later. So we have a lot of concerns about the virtual program even. We have concerns about the length of the school day. I've talked to several other parents in the elementary levels that are concerned about how we are going to manage our kids, especially, K through 2 in a 7-hour school day. So we want to know more about how synchronous or asynchronous is this school program going to be to accommodate these elementary age learners. So again, thank you very much for listening and for using science and what we currently know about this virus to make decisions for the whole of the community.
Thank you. Next up is a kindergarten mom. She states, it is completely unrealistic to expect our younger kids to learn in front of a computer 4 to 5 hours a day. Not to mention that working parents will not be able to work if they need to teach their children virtually, and for younger kiddos, be by their side the entire day. Please consider finding a way to let the younger kiddos in school for face-to-face learning. JK to 2, JK to 3, if there were more classrooms, the young kids would be able to social distance. I'm not sure what the cutoff would be, but the younger they are, the less successful they would be in e-learning. This does not mean I am discounting how difficult it will be for older children. Please know that there are a number of kindergarten families that are exploring other options for kindergarten education so that their children can receive face-to-face. I and these other individuals would not be registering our children with the school district and would be forced to pay for kindergarten education elsewhere. This is not what we want to do, but we feel we have no choice with our kids being so young. This virus is not going anywhere, even when there is a vaccine. Virtual learning is not a long-term solution. Have you considered opening the buildings for working parents or students of essential workers, which would include teachers, that do not currently have other options? If there are enough people willing to do virtual learning, wouldn't it be easier to social distance? How about a survey asking how many people would be willing to provide their own transportation in order to help the issue with enough space on the bus? I know there are many other obstacles that have to be discussed and considered. I just want to throw out a few thoughts. I typed this very quickly and I wish I had time to say more and organize my thoughts better. I appreciate everyone working so hard on a solution. I know this is extremely difficult for everyone and we all face challenges. Thank you. Next up is Robin Carmer. And she states, hello, my name is Robin Carmer and I am a special education teacher at East. This will be my 3rd year in the district and I can confidently say I love everything about our district. I love our students, our staff, and the community of South Lyon as a whole. I believe that we have a strong education system with amazing teachers. As teachers, our biggest focus is to educate students. Students require consistency to learn, especially our students with IEPs. If we return face-to-face, then have to go back to virtual learning, the inconsistency and interruptions of learning make an already difficult situation more difficult for our most challenging learners. It is not known that we will be able to return to school and stay there. Why risk our students' chances to learn and get an education when we are potentially flipping back and forth between being in the buildings and going virtual? For students with IEPs, this will result in a disruption of special education services, which are state mandated. I have received multiple emails about student athletes and even a South Lyon East high school staff member testing positive, and all sport activities were canceled the next day. Is that what is going to happen when you pack 35 students and 1 or 2 teachers in a room? How can you cancel sports activities and not cancel school? If you do cancel school, how do our students learn? I believe that to keep students safe and to consistently educate our students, we need to start the year fully virtually. Next up is Caitlin Piles, and she would like to speak about concerns as a teacher with returning in person. Are you on the line?
Yeah, can you hear me?
Yep, go for it.
Okay, so hi again. Thanks everyone for your time. My name is Caitlin Piles and I'm a special ed teacher at East as well. I want to thank you all for the time and effort you've put into analyzing all the different scenarios, complications, and considering the community input. I truly do appreciate it. As a co-teacher and provider of special ed services, a big part of my job requires me to be within close proximity to individuals or small groups of students. So whether it's reading or repeating directions, tap on their desk to get them refocused, a quick decision to grab their pencil and paper and write down their thoughts when they're visibly frustrated about their inability to put those thoughts into writing, or just a sympathetic hug after they confide in me about a rough night at home to explain their irritability and sleepiness in class.
These moments are what makes my job so special and why I love going to work every day. While I have definite reservations about all students returning to the building at the same time and feel that we don't have the resources to do so safely, I'm open to the idea of learning pods or small group settings to meet with some of my caseload students. I know the value of meeting with those students that are struggling is so crucial. Being able to assist them with online coursework and providing one-on-one attention would be a good compromise, in my opinion, and something I'm much more comfortable doing, as it would be in a more controlled environment and much less risk. So thank you all for your time, and just something for you to consider.
Thank you for your comments and your service to our district. Next up is Morgan Lacrone, and she's a student, and she says, I am a student at South Lyon East. I was leaning toward the online school option for fall, but I was disappointed to see that only one of my classes, physics, would be offered by a South Lyon teacher. I know most of my classes are available through Edgenuity, but I am concerned about staying engaged for 5 hours of video-based learning. From what I have seen on the Edgenuity website, it appears instruction is video-based, without a chance to interact or have discussion with the instructor. The Edgenuity website says questions will be answered through chat or interactive marker board with a tutor. I am worried that I will have questions, particularly AP Calc, and I was hoping to have an opportunity to get to discuss them with my teacher, as was done in the spring in the office hours. I am also concerned about AP Lang being effectively taught if there are no discussions with the class. Also, I am planning to take Spanish 4 and band this year. I don't see these as an option through Edgenuity. What is the plan for these classes? In addition, I am very concerned that the school is planning to open in the fall. The number of Michigan coronavirus cases currently is similar to the number of cases in the spring when we shut down. There is no vaccine and no cure for the virus. Nothing has changed. Why should we risk the lives of our staff and students when online school is an option? What about students with high-risk family members? I would hate for a student to bear the responsibility for their parents' or grandparents' death because they brought the virus home from school. Thank you for listening to my concerns. Next up is Evelyn Krieger, and she's a teacher in South Lyon. Are you on the line?
Hi, can you hear me?
Yep, go right ahead.
Great. Hello, everyone. My name is Evelyn Krieger, and I am an English and AP teacher at South Lyon East, as well as the parent of a 4-year-old little boy, Nicholas, who's very eager to come back to school for junior kindergarten at Salem. As both a parent and a teacher, I want to thank the Return to School Committee for making these recommendations for the safety of our students, staff, and teachers. I understand that this will be a less than an ideal option. I know that this will be difficult for many of our families, including mine, but I fully agree that fully virtual will be the most sensible and safe option for our community. Our students, our staff, our community members' lives are at risk, and this is not something to gamble with. There is still much that we don't know about the long-term effects of the virus, things that we won't know for years. And I think we have to balance our return to normal, quote unquote normal, with the safety of our community so that we are all here to enjoy that return to normal when that finally does happen. As a parent, I really want my son to be able to go back to school for the normalcy of it. I want to get back to normal, but if we return face-to-face this fall, it will be anything but that normal that we yearn for, and we can't kid ourselves about that fact. As my colleague Sarah Athey and others have mentioned earlier in public comment tonight, there will be no group collaboration, no teamwork, no sharing materials or projects. There will be little to no working with other students or even kids helping each other out if we follow social distancing as much as we possibly can. This is not school as normal. This will be nothing like normal. Many community members and board members have commented that life is full of risks, and I agree, it is. It's a risk to get out of bed every morning, but we also need to think about how we as a community can take calculated risks, not just risks in general. Returning in person at this time with this many complications is not a calculated risk. It's foolhardy and dangerous. By starting remotely, this gives us all time, as board member Mr. Kennedy suggested, to make careful and appropriate risks when the time is right. No one wants us to be virtual this entire year. Parents don't, students don't, teachers don't. But this is not the right combination of time, place, and situation to return to school in person. I desperately want my son Nicholas to have a school experience where he can play face-to-face with his classmates and enjoy all the wonderful tactile and collaborative projects that his junior kindergarten teacher is going to come up with, but not at the risk of him getting sick, not at the risk of my immunocompromised mother getting sick. not when there are more and more studies beginning to show that small children and teens transmit COVID far more easily than we originally thought, not when we still don't know all the lasting effects of this virus, which we won't know for months, if not years. By deciding to go virtual now, we can give teachers that much more time to prepare for online classes rather than having to suddenly change directions as a result of an emergency. I know my colleagues want to be back with their students. I want to be back with my students. This is going to be my 11th year in the district and my 20th year as a teacher, and I know that my amazing colleagues and I will do our very best to support all of our students and their families as much as we possibly can during our time in a virtual model. No, it's not ideal. Yes, kids lose out on social interaction and the in-person stimulation that regular school provides, but school won't be regular this year. And what if a return to school at this time causes us to lose teachers, students, or members of our community permanently? Where is the greatest damage? I realize this leaves many unanswered questions, and we will still need to decide when the time is right to return in person. But I truly don't think the time is right, not now. Thank you for your time and consideration.
Thank you for your comments and your service to the district. Next up is Jordan Dashner, and she states, I am going to be a senior at South Lyon East High School, and I understand that while the virus does present a reasonable threat, I know me and my fellow students would benefit from in-person school. Learning from a distance, I know, was hard mentally on me and a lot of my peers. Our online course load was also nowhere near what it was in person, making it very difficult to learn and retain important curriculum. Luckily, when we first went online in March, we were early into our second semester and had background knowledge on the subjects we were learning. At the same pace, I would be very concerned starting the school year online with all new curriculum and not already having a semester of learning in our classes and trying to cover and retain everything outlined in course curriculum. Being in a lot of upper level courses as well as AP classes in person is important to my success in these classes, as they require lots of hard dedicated work that is challenging to do for hours and hours at a time behind a computer without the immediate connection to a teacher or other students for help. I very much appreciate all the dedicated hard work administration has put in to create a very detailed roadmap that allows for in-person or online to allow families to choose what would work best for them. I know for me, it would benefit tremendously to be in person, so I would urge you to please keep this option available for me and my peers and the rest of our district. I would much rather wear a mask for 7 hours a day and distance from my friends and classmates than be learning online. Thank you for listening and your consideration and for all the hard work you have all done. Next up, Nicole Abermanis. She states, as an elementary teacher and a parent of 2 elementary students, I am concerned about students eating in the classroom. There's not enough space in the classrooms to space students 6 feet apart, particularly in the classrooms that use tables instead of desks. I feel the cafeteria is a space that would allow students to spread out and remove their masks in a larger space. Parents of young kids know that it is difficult for them to pay attention to the juice box or water bottle they are picking up. If they are sitting right next to someone, it seems very likely that they will grab the wrong drink and may not realize until after they drink it. Providing more space between students could reduce accidentally touching or consuming another student's food or drink. Also, allowing students to go to the cafeteria would allow kids to move to a different space. A change in their environment can provide a much-needed brain break that students will need to keep their brains engaged in learning. Thank you for all the time you have spent on trying to find ways to make sure that our students can learn and be safe. As a parent and a teacher, I've spent countless hours weighing the odds for my own family and myself and worrying about my past and future students. I can only imagine how difficult this time must be for all of you, and I thank you for all of your time, thought, and hours that you have spent considering the various concerns and recommendations of the various stakeholders. Next, Steve Bohanian just wanted to comment on returning to school. Then we have a high school parent that states, I want to thank the board for all the hard work you put into coming up with the plan. It does not seem we have the staff or money to support in-person learning at this time. Please move forward, delayed in-person start. I would rather you put the money and time making the virtual learning the best it can be. I support the teachers and students to be safe. As a father who had to go through a family member passing away from COVID, it had a profound impact on my family. If you let the students go back to school in September, it would be like allowing students to cross a busy street without a crossing guard and saying it's okay with the risk of a kid being hit. Be the crossing guard and delay the in-person until it is safe. Lynn Russell states, my daughter with autism did not do well with online instruction. We are not able to support well during the day learning as both my husband and I must work. We are both essential workers. What are we supposed to do? And then we have Catherine Duncan would like to call in to talk about physical education. Are you there, Ms. Duncan? You need to press *6 to unmute your phone if you are there.
Hi, yes.
Yep, we can hear you.
Hi, yes. Can you hear me?
Yep.
Hi, yes. Hi, I'm also I'm a parent of a 4th and 2nd grader and in the district at Bremer Elementary. I have concerns both as a parent and a teacher in the district. This will be my 5th year at South Lyon East High School. I teach PE and health, and a lot of what you are saying is geared more towards the classroom teacher, and I just wanted to give you guys some points coming from a physical education gym area. My concern is the number of students that are currently enrolled in my class. Currently, I have a class average of 45 kids in my class. I have tables when we are in the classroom, because I also teach health, where students normally sit in groups of 5 to squeeze 40 students in that classroom. Even rearranging my tables, I can get 38 students, but they will be paired with each other and sitting 2 to a table and still limited space in between. The proposed block schedule for the class, I'm kind of just the graduation required class is the foundations of health and physical education. So I'm just going to kind of highlight on that class and not the electives that we also offer. Would be as follows. So the block schedule is for like our in-person. One class would possibly doing physical activity for the 1 hour in the 2 hour block. So they would do our physical activity, change in the locker room. During activity, students are to wear a mask, whether we are inside or out. Who is cleaning the locker room? When there's up to 100 students, they'll be going through both the men's and women's locker room. Who is cleaning the equipment, and how, if you're asking us to clean the equipment, how do we clean that much of equipment? Drinking fountains are to be turned off, but if a student is having my class 3rd hour and they already drank all their water, how are they going to refill it? We do have fountains that you are able to refill at least a water bottle. So I don't know if that function could be turned on. So they're only touching the one, it's a sensor, so that all they're doing is touching the water bottle anyway. After this 1 hour activity, we would possibly switch with my other colleague into the classroom after they go in and change in the locker room. So now who's cleaning the classroom that now my students are going to be going into? Sorry, getting my notes here.
Yep, no worries.
Mr. Archibald already made the point, but I'm going to reiterate again. The pools and gyms are currently closed in our community, but our curriculum asks to familiarize students with swimming skills and also the machinery in the weight room, because we focus on lifelong fitness. As stated by my colleagues, I love teaching. I love my job. I love getting to know the students and seeing them grow personally and physically and having those physical goals. Teaching virtually is not ideal, but it's doable even in physical education. I did it remotely. I had virtual workouts where I offered students the opportunity to join me at 10 a.m. and do a workout with them. If they didn't join, I recorded myself and had them post their heart rate and everything for the workout as proof. Obviously, if we go virtually, I'll have to have more accountability for them and have them show up virtually, and that would be their attendance with me. Obviously, this is not ideal, but I just wanted to give you a different outlook of what physical education realm would look like and pose some more questions for you guys to maybe think about. So I thank you for everything that you guys have been doing so far and talking about everything for the safety of our teachers, our students, and our community. Again, like I'm a parent in the district too, so thinking of what my 4th and 2nd grader are going to look like at Brummer. What am I going to do with them if I have to go back virtually and or go back in person? What am I going to do with them if I don't feel comfortable with them going back to school? So I know that's a lot of things to think about, but I thank you for your time and everything you guys have been talking about.
Thank you for your comments and your service to the district.
Thank you for your comments and your service.
Okay, next up is Allison Bowler. And she states, if we are staying remotely, why would there be a separation between the virtual classes and the remote classes? Why wouldn't all the kids stay together virtually and segregate out those that opt for in-person instruction once it's available? Next is Michael Rizzi. Are you there, Mr. Rizzi?
Yes, I am. Sorry.
Oh, yep, go for it.
Yep. Yep. So one of the things that I had a question about was I saw that when you first did the initial thing in June, asking, you had a whole bunch of questions that you had asked about how people felt about various different topics about returning versus the virtual learning. When you sent out the question just recently that you said that, well, that there's been a shift of people that of their feelings. On the very first, you only asked 2 questions. The first one was about how you felt comfortable of returning, and how you felt comfortable with putting 6 or 7 different things into a single question that you asked. And then you asked, so I was comfortable with some of the things that you had said, but not other of the things that were said in the exact same question. So I couldn't give you an exact same reason of saying that I'm very comfortable versus I had to say that I was a 3 instead of a 5. Let's say. So there might be a skewing of what the results were that based upon the way that you asked the question. Just like then you said, well, what if we just go back for the second question? So what I would think would be a good thing to do would be to actually repeat the exact same questions that you had asked back in June to then see exactly how people's opinions have changed, instead of trying to say that, well, I put something together and now I'm changing what the difference is. So you really can't, you're comparing apples to oranges than actually comparing the same things and getting the exact same questions and being able to see where the responses have changed, because some people might have had to change their response of how they felt because of the way the question was asked and not because of how they actually feel. So that's my concern, and I think that it was a terrible methodology of trying to get information when you need more information and not less to go and make a decision upon.
All right, thank you. Next, a student states, thank you, Mr. Archibald, for thinking of the safety of our students. I would rather be in school, but I also don't want to get sick. I support you in the remote start until we can get to the next phase. Meredith McNamara states, will there be a difference in options for classes that are offered from the district at the high school level from the remote to virtual option? Will there be more information presented regarding the differences between the 2 options prior to the decision date for parents? Heather Dashner states, I am very disappointed to learn that the district is backpedaling. I feel that this reaction to some people in our district making bad choices. I work for a manufacturing company that very successfully sent their workers back to work. There are several companies out there doing this on a daily basis. Reach out to those companies and learn. The best learning for our kids is in school. They will learn the new ways, masks, social distancing, etc. Kids are better at adapting than adults. Okay, Ralph Cortese says, when I saw the invitation and notice for this meeting, I became concerned that the district was floating a trial balloon for overriding the overwhelming voices of the parents. The last survey results I read were that over 80% of the parents wanted in-person, in-class, full-time education. Manipulating the inquiry to solicit another response, favorable or supportive of your hidden agenda to remain on virtual learning, is intellectually dishonest. It is easy to forget that we, the parents, and the clients/customer, we pay taxes that build your schools and pay your salaries. As much as there is a belief that virtual learning is good enough, I can tell you for elementary students, it was not and bordered on ridiculous. Minimal education and borderline quality. 1, maybe 2 Google Meet sessions per week and the rest self-taught. Under no theory of education is this suitable for elementary students. Nurses go to work, doctors go to work. Even the minimum wage employees at Walmart go to work each and every day. If the district is not prepared to offer full-time in-person instruction, there should be vouchers given to parents to send their children to educators that are willing to teach. Today on the call, a physician and epidemiologist stated it was safe to go back to school. Why are you ignoring the experts? The CDC recommends in-person education. Dr. Fauci recommends in-person education. Evidence-based decisions, please. As I watched your presentation, it seemed that you are being dishonest. You are punting and will find more reasons in October to stay on virtual learning. We don't have staff to clean. We don't have enough supplies. Lions and tigers and bears, oh my. When will things ever be perfect enough? Teachers that are uncomfortable or don't want to teach have choices. Parents that don't want to send their children to school have choices. Sorry, this is difficult to read. As well as they can avail themselves to the virtual model or homeschool. As I watch your presentation, it seems that terribly disappointed in this plan and the intellectual dishonesty in altering the full-time in-person desire of the overwhelming number of parents. Amanda Wilt states, I hope that we will consider phasing back from remote learning to in-person learning at natural breaks in the year, such as a semester break. That way, if a parent is uncomfortable with the current situation or the school decision, they would have the option of going virtual at that point or going back to in-person. Leanne Sanders just represents students, parents, and taxpayers. Anonymous says, thank you all so much for your time and efforts in this difficult task of planning the 2021 school year. I would like the board and the community to fully think about what a normal in-person class day will most likely look like for our elementary students under the current mandates. Students will not be able to distance in accordance to the 6-foot mandate, especially as class sizes will increase for this upcoming school year. Students will not be able to sit in groups, nor will they be able to work in groups. Students will not be able to share any material in the classroom. Students will not be able to move around the room. Students will be eating lunch in the classroom, and recess on the playground may not be possible. So as a parent of a Southline Elementary student, I know my child as well as most children learn best with in-person instruction. But with all this information, school will not feel like or look like normal for our students. School will feel more like prison, and the mental health of our students will deteriorate under these massive changes. I know that our amazing teaching staff will do their best to make the day as fun as possible for their students, but it is not going to be the same. I also know that as students begin to rebel under those constraints, instruction is going to suffer as staff is taking time out of teaching to work with, support these students. If a class has to be removed from this room due to aggressive student behavior, instruction will be halted as there is nowhere for that class to go to continue learning. Kids are kids and they need movement during the day, which will not be an option under the current mandate. As much as I want my child to start the school year in person, I am concerned with the mental as well as physical effects of in-person learning on our elementary students, and if it outweighs the remote learning at this point. Thank you so much for your time and consideration. Jennifer Colosimo is a parent of one elementary and one middle school student, and she states, thank you for putting the safety of staff and students at the forefront of your discussion this evening. Your dedication and commitment to keeping our community safe is applauded. Michelle S. says, thank you for everyone's time and service on the school board. My question goes to Lisa Kudwa regarding virtual instructions at the elementary level. Noticed in the FAQs, there's a chance in which students will not have school teachers teach their own students within their schools. Students being mixed with other students from other schools to form a virtual classroom. How is this form of forming a stable community when students are not even with students in their own school? When and if students can switch back to on-site learning, they will now be in a different classroom with different students and teacher. Forgive me if I read the FAQ incorrectly, but I'm concerned that my daughter will not be able to learn with other students from her school, and her classroom is a composite of mixed students from multiple schools like Hardy, Brummer, Sayer, etc. Will this be a different Will this be a different case if we are back in phase 3 and are forced to do remote learning? How are tests given virtually? From this evening's meeting and hearing the multiple complications, it's very concerning and agrees about moving with caution and prepare ourselves for solutions and options. I like Dan's thoughts of phasing in slowly. There is no rush in heading back. Mr. John Martica states, you are allowing group sports and the like practices to happen, but you are considering not opening in-person schooling. How does that make sense? Craig Skulski says, will commitment date for online versus in-person be delayed since we are moving to a 6-week remote learning phase to start? If the return to in-person plan is not finalized, how can parents decide which option is best for their children? Okay, Michael Belcher states, first, I would like to congratulate the district on the bond passage. I would just like to thank Mr. Archibald, his team, and the Board of Education for their unwavering dedication to the district's staff and kids. Being an administrator in another district that is working on similar plans, I understand the difficult decisions you are being tasked with and realize that you are in a no-win situation. Just understand the community is with you, lead from the front, and keep up the good work. We all appreciate you. Mr. Blazak would like to speak about in-person learning. Are you there, Mr. Blazak? You need to press *6 to unmute. Okay, if you decide to call in, we can you can come in at any moment. But there seems to be a second comment from Mr. Blazak, and it says, in-person learning, this is not ever going away. Don't kick the can down the road and make our children suffer. Andrea O'Keefe says, what does it look like at the elementary level if many students from a particular school choose the virtual path, but almost no students from another elementary choose the virtual path? Could some teachers have very small class sizes while other teachers have much larger class sizes? This particular question came to mind while watching the meeting tonight, and I suppose it applies to the secondary level as well. Thanks for the very thorough job in presenting the plan tonight, and also thanks to the board for your thoughts and questions tonight. Sue states, any advice for working parents? Husband and I are gone 7 to 5, and babysitter is not going to be expected to monitor kids. Seems all your roadblocks are inconveniences to going back face to face. Getting kids in seats is more important. Brenda McCloskey would like to speak regarding safety and learning. Ms. McCloskey, are you online?
Yes, I'm here.
Oh, perfect. Go right ahead.
Okay. I am Brenda McCloskey. I'm a high school teacher. I've been at the high school for over 15 years. I want to start by thanking you for the opportunity to speak and for the countless hours so many of you have invested in trying to do what's best for the community and particularly the students. I guess there are two things really that stand out to me even before COVID. It's the safety of my students and making sure that they learn as much as possible. To be honest, 2 months ago, I would have said, get me back in the classroom. I miss my kids. I want to see them in person and build relationships because I know that's critical to learning. But as I started to have a realistic understanding of what that looks like with all of us wearing masks and kids sitting elbow to elbow in my classroom with no possible way to distance them, and because I teach at a high school, 5 classes of 35 kids churning through, even with a block schedule, that's 80 kids in that room over the course of a day. That's a lot of people breathing the same air, no matter how good I clean between classes and how much I'm willing to invest. I don't know how I would ever live with myself if one of my kids got sick. Not even to begin to bring in what if I get sick or taken home to my family. So I appreciate the concerns that have been expressed tonight with regard to that. I also know that the learning is still one of our priorities, and so we have to find a way to make those two work. I think some other teachers have mentioned this as well, but one of the things that I fear so many parents don't realize is that in-person learning in this COVID environment is not what everybody thinks it is. We don't get to collaborate and do all the things we do to keep them engaged by switching it up every 15 or 20 minutes. It's going to be sit, listen, take notes for 2 hours at a time. I mean, quite honestly, as an adult, I'm not capable of doing that. So I don't know how our kids are going to be able to effectively learn when it's just them and their mask for 2 hours at a time and they can't collaborate and do group work and all the other things that we do. So I love the idea of the transition, reevaluating it 6 weeks out and looking for ways to get back there. I think we lose something either way. I think we lose less by putting safety first and starting remotely until we're comfortable that we can go back safely. So I just want to thank you again for all the time and effort that you guys have put in. Especially, I know it's getting late and you guys have great persistence. So thank you. And I look forward to hearing the outcome.
Thank you for your comments and your service to our district. Next is Andrea Wilkins, and she wanted to speak on in-person instruction. Ms. Wilkins, are you there?
Yes, can you hear me?
Yep, go right ahead.
Okay, so I apologize. I've been taking notes and I'm probably going to speak in bullet points here. So
no
sorry
worries.
if it's a little staggered out. I also wanted to echo Mr. Rizzi's comment earlier about the survey. I didn't even answer it because I felt like there was no way that I could answer it without it being misinterpreted somehow, because it asked so many questions in there. So I think if you maybe surveyed again, you might get a little bit different response. Also, I wanted to, I fully agree with Mr. Dashner and Mr. Clark's comments from earlier about, you know, if it does go remote, what is the measure that says that we will be able to return? Because right now, my confidence level, if we start remotely, my confidence level of returning at all is extremely low, given what we've experienced back in March when it initially started as 3 weeks and the whole 15 days to slow the spread thing. And here we are now 5 months later in August, and we're dealing with the same thing and the same issues. And it just seems like there's no actual point where we can say, okay, as soon as we hit this goal, we are able to return. So that's my concern in terms of planning. Also, with the remote start, I'm a working parent, you're a working family. I've spent all week trying to figure out what to do and what to do. You know, do I hire a tutor? Do I send him to daycare? What do I do to make sure he's getting instruction? And he's a first grader. I can't expect him to independently navigate these courses online and actually be held accountable for this. I've done some quick calculations over the course of the week, and honestly, if I look at a tutor or childcare, I'm looking at $12,000. That is a lot of money. So I don't even know what to do. I mean, if I don't think we're returning to school, do I take that $12,000 and put them in private school? What do I do as a working parent? So I guess I would like a little more guidance on how the actual 6 week will go and what will actually be the measure. I also wanted to bring up a lot. I mean, there's a lot of talk about, you know, we can't do this, we can't do this, and we can't do Y. I think, you know, and this is definitely a once in a lifetime situation. I think if you ask what the parents are willing to do to get these kids back in school, I think you get some, like somebody said earlier, some creative responses. You know, my son is, he's scheduled to be on a bus. I would absolutely be willing to drive him to school all year and commit to that if it means we can distance more on the bus and meet those regulations. Like, what are the parents willing to do? I am fully willing to get him into school however that needs to be. You know, do I need to donate some supplies? Do we need to switch days? You know, originally I was very against the hybrid model. I wanted him in school 5 days a week. You know, but if it's a hybrid model or remote, I mean, I would absolutely be more for a hybrid model. So maybe that does need to be reevaluated. So that's all I wanted to say. Thank you.
Thank you. Next is Brenton Monty, and he wants to speak about the social emotional considerations and curriculum. Are you there, Mr.
Hi, can you hear me?
Yep, go ahead.
All right. Hi, thank you. Hi, I'm Brenton Monty, a Centennial Middle School teacher, coach, and community member. I'm going into my year 11. I'm just speaking for myself. First off, hello to everyone. Thank you for your time and work during this difficult time, and thank you to the board for not making this decision very political, unlike some school boards around our area. There are thousands of questions and really no good answers. I also want to welcome Mr. Archibald to our district, and a special thank you for involving teachers in our return to school committees. I want to express support for a remote start for the year, especially concerning secondary schools, as that is my expertise, I guess. I'm not really speaking to safety concerns or complications. I think Mrs. Athey from previous comments today at the start of the meeting really hit them all perfectly. I wanted to speak more on the social emotional part. One of our guiding principles in South Lyon is to try and do what's best for kids, and more recently, have focused on social emotional considerations. I don't think anyone really wants to teach virtually, but that really is what's best for kids at this point. You know, I see and hear parents who want to return to in-person school talk about how their children didn't do well with remote learning in the spring, and they do better with in-person instruction and need the socialization aspect of school. I think the presentation really hit this well today, that and our conversation really seems to be missing and less centered, but I've heard more comments in the secondary part of the meeting. But socially distant school isn't really good for socialization or learning. Everyone is adapting and kids adapt very well overall, but with masks and social distancing, there's really little to no group interaction outside of a screen and very little socialization outside of friends they already have. So if you aren't getting any of the benefits of being in person, it just seems better to stay safe and at home and at least be able to see each other's faces online. It'll also be a really challenge for teachers in the schools to build quality relationships with students, something that is key to their achievements. Even one-on-one discussions are basically impossible in a social distancing world. You know, you can't pull that kid aside and have that private conversation because you have to be so distant. And this is just a side note too, I was thinking about this. Waiting to start in person for 6 weeks will hopefully give us time for Chromebooks to come in, which gives us some more opportunities and to give us some opportunity for social distancing there too, and sharing of equipment. Remote learning in the spring, as many of you said, it was an emergency measure where we had to pivot to a whole new model in days. If you do make that decision to start our year online, you know, we as teachers can work to create a better online experience. You know, one of the difficulties now that we're having is, you know, we know that if we do return to in-person learning, you know, no one thinks this is really going to last. You know, in a best case scenario, we're going to be jumping between remote and in-person all throughout the fall. You know, it's not good for consistency. It isn't what's best for kids. It isn't what's best for planning. You know, Mrs. Hanshaw made a great point that starting the year remotely really trains everyone how to use it as we do phase in and out as needed. You know, the spring was very tricky because we weren't really able to teach those students how to use those platforms. We just jumped right into it. So by knowing now what our plan is, we can plan more effectively and make it, you know, a better experience for everyone. It's not ideal, obviously, but, you know, safety and just being able to learn a little bit more, maybe that on that online platform. So again, thank you for your time and hard work. And, you know, no one really envies your position in making these decisions, but thank you for listening.
Thank you for your comments and your service to our district. Let's see. Next up, Carolyn Mason says, remote learning electives. Would all electives such as CAD, Tech, AP classes, etc., be offered in the remote learning? It does not look like they are offered in the virtual option. Jenna Setsuda says, hello, during the meeting tonight, the idea of a phase 4.5 was mentioned. I'm curious why we are steering away from the fork in the road of kids getting to choose a virtual versus in-person learning model. That seems like a perfect way to phase into the schooling that we had 12 months ago. Using round numbers, say 50% of the students wanted to return and 50 wanted to maintain a virtual learning environment. With such small numbers, we could achieve social distancing, small class sizes, the hallways would be less crowded, less traffic at pickup drop-off, fewer tables needed in the lunchrooms, etc. Less people means less opportunity of exposure. I'd imagine these numbers might mirror what the staff wants to do too. I'm sure many are looking to teach virtually, while a good amount are also wanting to come back to the classroom. This seems like the best option to please the most people. I hope you're still keeping this idea on the radar of allowing students to choose an in-person or virtual education. A parent states, if the district decides to start remote or hybrid, Has there been thought to utilize the early childhood staff and parapros at the ECC who are certified teachers K-12? Another working parent states, Mr. Clark, thank you for advocating tonight for a hybrid plan. I wrote a letter to Mr. Archibald expressing many of my concerns. Every single parent that I have personally talked to who initially voted on 5 days of full-time school has said they would be happy with a hybrid plan. Many of us thought that 5 days wouldn't even be an option during phase 4. This is likely why the numbers have changed at the time of the second survey. 2 full days of school would be much better than 0 days of in-person learning, especially for working parents and children who truly need in-person learning. At least parents would have some flexibility balancing work if their children were at home only part of the week. I beg the others to please take this into consideration. Brian Anderson states, based on what was presented tonight, it would seem the state requirements for phase 4 in-person instruction are financially unattainable. The cost for just masks and soap alone was upwards of $50,000. Assuming state requirements must be followed, the state has left schools with only one realistic choice for phase 4, virtual or remote, which is very sad. A mom states, what is the plan to accommodate the 28% of families without adequate technology? Kathy states, I would like to say thank you for this new proposal to begin with 6 weeks of remote learning. I hope all board members will support this proposal as it seems the best way to safely start the school year with so many unknowns to still figure out. I want my children in person, but I worry too much about the schools not being able to proper distance and have some having poor ventilation. Not only that, but I'm an older parent and maybe my children would be okay. But maybe it's scary and I'd hate for them to lose a classmate or a beloved teacher or even a parent because now just doesn't seem the right time to jump back into in-person learning. Hopefully cases will go down, but with all the parties I have personally witnessed in my neighborhood, not all being outdoors, I unfortunately only see the cases rising in our community before things get better. Thank you. Lori Coppola says, first off, thank you to all board members for your service and dedication to our district. You are appreciated. This is in direct response to board member comments. Please do not assume that the families who wanted or preferred 5-day in-person instruction would not opt to a hybrid model of 2 days in person, 3 remote, or whatever that looks like. When we responded that we preferred 5 days in person, it was over the hybrid or virtual options. If in-person is now off the table as an option, I can tell you that many of us in that 5-day preference category would take the hybrid 2 days. My husband and I both have 20 years in our careers that we do not want to give up and are now working from home indefinitely. The virtual remote option indicated that we needed to be available to moderate our elementary children's learning. While we have some flexibility with our current positions, we would much prefer that our children have 2 days in school, 3 at home, as this alleviates at least some of the pressure we will feel trying to manage being a high-performing employee as well as an assistant educator and caretaker of a 9 and 7-year-old. If 5-day person is no longer an option, take another survey that includes a hybrid option. Lawrence Baker says, please explain the difference between remote learning and virtual. Have you considered working with local daycares? I know several have made plans to help students with their remote learning with a teacher at their facility. Lynn Russell states, my daughter with autism did not do well with online instruction. We are not able to support well during the day learning as both my husband and I work and must work. We are both essential workers. What are we supposed to do? Jennifer wants to, or just talked about grades. Amanda states, has the idea of having a 6 to 12 be online learning and K-5 be in the classroom been thought of? This could potentially allow all elementary age children to be spread out in other buildings, allowing for social distancing. I would like to hear more about how you plan to support families that have to work and cannot stay home with elementary children. Will there be any options available? Half of the district wants their children in school. Only having half of the children at school would allow for smaller class sizes. Is there any way to see how many children would be at each building to see if in-person could work? Jennifer states, I keep hearing from our more affluent households that they are hiring nannies and full-time tutors. I'm assuming these kids will have straight A's. Where does this leave our lower income families? It will be a huge gap in grades because a lot of students don't have the people or resources to help them achieve good grades. A South Lyon teacher states, "Thank you, Mr. Archibald and Cabinet Committee, for hearing our thoughts and concerns about what the risks of in-person instruction first. At Elementary South Lyon, I promise to create a positive, engaging, and rigorous online classroom community until we can meet safely again in person. To the few South Lyon board members who initially viewed this updated plan as a negative, your response is disheartening. As you meet virtually for a board meeting, you are pressuring teachers and students to be in a high-risk, in-person environment of over 30 people in a small room for 7 hours each day. The outbreaks are going to happen and have already happened in our community. I urge you to reconsider the virtual and remote options as a positive, consistent, and safe educational environment. The concerns and obstacles to in-person instruction are real and are coming from educated professionals that are in the trenches day after day, who are being asked to meet unrealistic pandemic guidelines. It may help you understand these struggles by acting out the requirements both teachers and students will be asked to do every day, such as wear a mask for 7 hours, clean 30 classroom desks 5 times a day, put on a face shield and gloves to clean our classroom bathrooms throughout the day, keep students socially distanced from one another, monitor if students keep their masks on, monitor if a student shows symptoms they are sick, and the list continues. Do these sound like the daily roles of an educator? In the virtual and remote plans, students will receive their full academic workshop times in a structured format, which is much more comparable to a typical school day than the above pandemic obstacles would allow. Please do not compare knowingly exposing South Lyon students and teachers to a deadly virus pandemic with a random car accident. The risks do not compare, as forcing a return to an unsafe environment is intentional. We all want to get back to normal, but it is just not possible. The act of forcing normal back is unrealistic and juvenile. We are educators. Our job is to teach your children in the best of our ability, which we can do virtually until it's safe. We are not daycare providers. The childcare obstacles families will face are real, and we understand that as we are facing those same struggles with our own families. However, the safety risks of in-person instruction are scientifically proven and do not compare to someone's convenience of childcare or their hope that things will return back to normal. Teaching remotely is a much more challenging task than teaching in person, and we are happy to put that work in to keep us all safe. Please consider putting the health and safety of our students, staff, and community before all else. Thank you. A high school parent states, "One issue many of the children had in the previous online version related to multiple Zoom classes scheduled at the same time. Please consider this issue when planning for the online option. One other thought is whether students will have the option to change their schedule to shift to classes favoring remote learning." Gabriella Porsuk is a parent who states, "I have 2 children in South Lyon District, and we are leaning toward all-year virtual learning. However, I am not convinced current distance learning plan will work for us. We are looking at different options that would give us more flexibility, having the ability to work on the material later in the day or during weekends. I noticed mentioning Edgenuity. Could you provide us with more information about that option? Thank you." A mom and teacher says, "I would like to bring attention to the fact that using disinfectant chemicals in the amount and frequency recommended in the return to school roadmap creates an extended exposure risk to teachers and students. This is a hazardous proposition, creating another problem for a whole group of people, staff and students. Even OSHA recommends protective clothing. Has this been acknowledged? Teachers are not trained in the use of these chemicals, and proper ventilation has not been outlined in all of these plans. This is worrisome, as research shows this creates a whole host of other health issues, including neurotoxicity. This is especially true for people with asthma, migraines, etc. Please keep our students, staff, and community safe by delivering online instruction. This will undoubtedly save lives." Brad, a concerned parent, states, "Thank you for your time and consideration tonight. My wife and I have 2 elementary children in the district. We have been very cautious in recent months, following all protocols laid out by the governor and local leaders. Bottom line, we take COVID very seriously. Additionally, I came from a family of educators. My mother taught elementary school for 40 years, and over the years, she has explained all of the problems a return to school could create. That said, I firmly believe the South Lyon Community Schools are making a poor choice to not allow in-person education. In central Indiana, schools have started to reopen. Other schools will follow. What have they figured out that South Lyon has not? I led a global team at work, talking to my colleagues in Europe and Asia. Their kids are back in school and things are working well. Their kids go to school and straight home. Their families understand now it is not the time to congregate with friends, etc. Again, I ask, what have they figured out that South Lyon has not? Their schools are staying open and children are not getting sick. On July 20th, you shared South Lyon's back to school plan. In today's meeting, it is clear South Lyon is not ready to implement this plan. What really changed? Was the plan you presented on July 20th just not thought out? I would recommend the board consider strongly rejecting the superintendent's recommendation from the data tonight. Approximately half of those who completed the survey are asking for in-person instruction. Don't underestimate for a minute the amount of children that will be pulled into private education. Christine Campo says, Kroger, Lowe's, Home Depot, etc. have all been working and open since this pandemic started. They have not shut down or closed for deep cleaning. They have gone about things as usual. Schools can learn from their processes. Kelly Bingley would like to speak on the return to school plan. Ms. Bingley, are you still around?
Hello, can you hear me?
Yes, go right ahead.
Okay, good evening, everyone. First, thank you to the task force and all involved in working towards getting our students back to school. The effort is beyond evident. My name is Kelly Bingley, like you said, and I have been privileged to teach in the South Lyon Community School District for 13 years. I have vested care and concern for the students that I teach, their families, my colleagues, their families, and the community. As a result, I'm concerned about the reopening plan as it stands and in the context in which it's being executed. We are in a different place now than we were in June and July when these plans were initiated. Since then, there has been community spread, particularly among teens, that is making headlines. Cases in general are on the rise. Our South Lyon sports teams have had transmission while back at practice. Major League Baseball and NFL have failed at mitigating despite their unlimited funding and resources. Schools and camps have had to close doors quickly, some within hours, when their attempts to reopen have failed. And new research and studies are showing this virus's effect on kids and their ability to transmit it is stronger than what they once thought. Therefore, I'm respectfully requesting answers to some of the components of the plan to ensure the safety of my students to whom I am committed, my colleagues who I care about, myself who is considered vulnerable to this virus, and my daughter who is also considered high risk, who I will be coming home to after my very, very close exposure to 100 teens and everyone in their circles daily, and that thought is extremely hard to bear. My questions are as follows. First, how is the district handling presumed or tested positive cases and contact tracing? Number two, if a teacher or student tests positive, does every other teacher or student that has been exposed have to quarantine? What does this look like, seeing as one student or one teacher will come in contact at minimum with 90 to 100 other people in a given school day? Number three, does the district have a deep reserve of guest teachers to cover the inevitability of increased staff absences while considering that the pandemic is deterring guest teachers from wanting to enter the building this school year? Number four, some of our sports have been back in session following safety protocols and transmission is still happening. Are we doing enough to prevent it from transmitting indoors when social distancing is impossible, when it is proving not to be contained outdoors with protocols in place? Number five, do we have the staff, infrastructure, resources, or budget to reopen safely and stay open for longer than a couple of weeks? Number six, is community spread contained to a point that it is safe for a teacher and 35 students to be in a room without proper ventilation or any type of social distancing? Number seven, are teachers the ones to disinfect all desks, highly touched surfaces, and shared materials such as books and Chromebooks all during passing time? If so, who will be monitoring the halls to ensure safety measures are being implemented and followed? And lastly, is the district prepared for incredibly talented educators to leave the profession due to their lack of comfort with the safety measures? Hopeful that insight provided to my questions will bring ease, knowing that there are plans in place to do this safely. After all, there is too much at stake to do it any other way. Please understand that my concerns come from a place of care and respect for the learning process and the people participating in it. The last thing that I want to see is multiple abrupt shifts to remote learning throughout the year, because we all know that kids thrive on routine and consistency. Even more so, it would be absolutely devastating to see a student or staff member fall extremely ill to this deadly virus whose novelty has been unforgiving to all ages. As much as I desire to be in my classroom with my students doing what I love, it is hard to negate the science, data, and anecdotal evidence working against a safe start. I am a working parent who will also have children at home learning virtually, and I acknowledge the challenge that these altered scenarios present to families. I recognize how hard this is for all stakeholders, but I think we need to ask ourselves what we are willing to wager for the sake of returning to the idea of conventional schooling when it will be anything but that. A couple years ago at a professional development session, I put on a face shield without hesitation to practice being shot at with an airsoft pellet gun to ensure that I could protect my students should we ever encounter an active shooter. And with that being said, I have more hesitation now putting on that same face shield to protect them from a virus that knows no bounds, as I am not confident I can keep them safe in the given setting with the given resources. Again, I thank the task force that has been charged with an extremely difficult job, and the Board of Education that has a vote ahead of them of such magnitude. Thank you for affording me the opportunity to speak.
Thank you for your comments and your service to our district. Next, Alex McGee represents staff. And they say, as a staff member, there are many things we are worried about and curious about. As a normal day, a maintenance staff member already completes an 8-hour workday with many, many aspects that come up during the day, such as clogged toilets, blown breakers in the classroom, spills in the hallway, spills in the classroom, repairing any HVAC issues that happen during the day. With all of this now, they want bathrooms and touch points cleaned and sanitized every 4 hours. Who is going to do this? We already barely can afford the staff we have, as we laid off people already. So now, as a building engineer, the only maintenance staff in the building during the day, how do I do my normal job? That takes up to 8 total hours. And now add cleaning and sanitizing bathrooms at 4 hours. We have 14 gang bathrooms and 18 staff bathrooms, just in Millennium alone. Who cleans those? Now to touch points. Who cleans all the door handles? Who cleans all the other surfaces? Where is the cleaning equipment coming from? We can't even get the supplies to complete our jobs right now as it is. They want filters changed more in HVAC equipment to help keep the air fresh. When is this going to happen when our maintenance staff is too busy cleaning? What are we going to do with all the other preventive maintenance? Let it go down the drain and waste the money we don't have on replacing things that could have been prevented. Emily S. says, thank you for making the decision now to begin virtually and giving our teachers time to prepare. Julianne Sleek states, I think the hard thing is this decision is not just about the kids. It's about the hundreds of teachers and district employees. There is so much talk about how this virus doesn't impact children. Just because my child is less at risk because of his age, it doesn't mean that myself, my husband, or other families are not high risk. There are also several other factors to consider. Number one, will my child be getting more or less out of in-person instruction? In-person isn't perfect. Even when you take the masks out of the equation, what happens when they have to be in and out of the classroom due to 14-day quarantine requirements? How is that going to be any more stable than the virtual every day? And what happens if I feel like they are being exposed too much and I choose to keep them home for multiple days? Will they miss too much school to keep up? And we haven't even considered cold and flu season with multiple symptoms overlapping. If a child or staff member gets COVID, the recovery is not 14 days. It's months, and sometimes they are not even back to functioning after that amount of time, of recovery time. That lends to the possibility of hundreds or more children at risk of having to repeat their school year. Number two, mental health. Yes, online is tough on everyone, especially for my teenagers. But you know what will be more difficult? Having them grieve over the loss of multiple friends and teachers because they die during the school year. And it will happen. Even if the statistics remain low, they aren't zero. Someone they know will die. How is that mentally healthy for our children? Number three, will there be a vaccine out this fall? Can we delay in-person instruction until enough people vaccinate? But will people vaccinate? Or is the thought of herd immunity so far-fetched because so many in our country don't believe in the science of vaccinations? Overall, there are way too many questions right now to make a sound decision for an entire district. But when you lose a loved one to this virus, it changes your perspective. Losing my mom to complications from COVID has forever changed mine. It's no longer a statistic or a number to a piece of paper. It's a real person, and that is devastating. I can't imagine how I or my child could ever live with ourselves if my or my husband's decision caused a loss of a life in our family of 4. That's why I keep going back to. Everyone has to do what's right for their family. For parents, there's no one size fits all in this. It's all just difficult. However, I implore you to continue to do what's best for the health of teachers, staff, children, and family members of the entire district. Only offering virtual as an answer to those parents who are not confident in sending their child back face-to-face is not a solution. You need to offer the same level of education for all students in this district by district educators, not a virtual company that you've contracted with. To both the school district and the Board of Education, I urge you to offer a remote start for the entire district to save lives in both our district and community. Thank you. Courtney Rose is a parent who states, I am writing to ask you to not reopen in-person instruction for the fall for our school district. I'm a teacher in another local school district, and I have 2 children attending South Lyon Community Schools. I am fearful for their safety as well as the safety of their teachers and our adult school community. While I understand and agree that in-person learning is important, I am not willing to allow my children to be sick or to sicken others in my family. I'm not willing to put my children in a position where they could potentially sicken their teacher. Can you imagine the trauma of a child feeling responsible for the death of his or her teacher? It is not something I'm willing to do. The COVID-19 virus is changing our entire world, and it is time for those who care about the safety of our communities to look at online instruction as our option and priority for the 2021 school year. Please be creative and work with our district's educational leaders to make a plan for a comprehensive, rigorous, and appropriate distance learning plan for the upcoming school year. Thank you for your time and consideration. A community member states, hi, thank you all for your attention to this. I am a provider in family medicine in this community. I live in this community and my kids attend South Lyon schools. You don't have the time for my medical assessment on this topic tonight, but like the pediatrician that wrote in, I wish I had shared it, considering all the options I have heard tonight, all the opinions I have heard tonight. I will say that unfortunately the survey questions were not phrased in a way that I could answer them to reflect my actual feeling regarding sending my kids back to school. Comfortable is not a word I would use when it comes to sending my kids back to school. I am comfortable sending my kid back to school because we have lived with this virus and it lives in our lives, considering my work environment since day one. I am not confident in the district's plan or any district's plan for relying on the health departments for guidance when cases arise, as they will. It's not the health department's fault either that I have limited faith in them. It's the lack of guidance they have from their leadership. I'm worried that one positive case in a classroom will lead to an unnecessary whirlwind of chaos for our kids. Fear is sadly dominating the situation, and basically the message is that nobody is allowed to get sick anymore. I actually have a large community-based elderly, aged over 65, patient load, and they are babysitting their grandkids and going to the grocery store, etc. So all the concerns that are being shared are very interesting to me. This is turning into a lost generation as we continue to debate these topics. The saddest cases are the most socioeconomically challenged ones. The death rate is stagnant and has been for months. The case numbers are increasing, but the more we test for something, the more cases we will find. Be it coronavirus, MRSA, diabetes, etc. It doesn't mean it is causing major issues, i.e. death everywhere, as again, the death rate remains flat. There is no easy decision on this. Thank you and good luck with your decision. Anonymous states, I want to know how these teachers are going to be able to teach remotely with their kids at home. What kids will they be teaching, the ones in their class or their own? A mother of a high school student states, can we put schooling ahead of sports, especially in the high schools? Right now, I am witnessing sports teams practicing every day, yet we are still debating whether or not our education is going to be in person. How does this make any sense? Jenny Wertheimer is a parent of a middle school student. She says, we met with my daughter's pediatrician last week and would like to ask for in-person teaching. Could middle school and high school students stay in one class most of the day while the teachers change rooms? When the students have to change classrooms, could you stagger the times to change classrooms to reduce the number of students in the hallways and the number of close interactions? Hundreds of kids attend the middle schools, thus the hallways are crammed with students 8+ times a day going to and from classes, lockers, and lunch. Thank you. And David Pease is a teacher and parent of 2 in South Lyon, states, "It is not fair to compare schools and education to other industries, businesses, or professions. Kroger, Lowe's, Walmart, etc. have much deeper pockets than we do, and they are much more able to provide PPE and manpower to fulfill necessary requirements to keep people safe and healthy. It is also unrealistic to compare teachers to other essential workers such as doctors and nurses because they have systems and processes in place that allow them to take necessary precautions between patients. This is not ideal for anyone. If we have the ability to delay the start of school and buy some extra time to learn more about the virus and discover new solutions to keeping our community safe, then we should use it." Christine Campo says, "It feels to me that some of the staff are overly concerned about doing the extras that go along with returning to school during this trying time. I know firsthand that every single essential or non-essential worker out there is having to do extra in order to continue to run or keep our businesses open. We are wearing masks, doing extra cleaning, working much longer hours, and changing the way we've always done things. It's what we have to do for our community, customers, and now our students. It's time to step up and put our children first." A mother of a high school student states, "Can we put schooling ahead of sports, especially in the high schools?" We already read that one. Michelle McCara is a district parent and South Lyon Community Schools substitute teacher. "Thank you to the Board of Education for your dedication to this district and especially the issue at hand. I know that whichever option is chosen, many will not be happy. However, we are in the middle of a pandemic. Nothing is normal. I hear so many parents say these kids need to be back in school with their friends. When I hear this, it touches my heart, as I have 3 children here in the district, 10th, 7th, and 6th, and I agree, our children need their socialization. However, at what cost? What are we willing to risk? This virus is unpredictable. Sure, kids have been diagnosed and recovered, but many are not so fortunate. For face-to-face instruction, who are we willing to risk? For being with friends, who are we willing to risk? I wasn't surprised at all when the Ann Arbor School District announced their return to school as completely virtual. I think our district should take a serious look at why they came to that decision. I support virtual as well as hybrid. Thank you for this opportunity." A mom of a high school student states, "Why are we still debating for in-person and virtual? Why can't parents just decide whether or not they want to be virtual or in person, as we were able to before?" And that is our last public comment. So with that, our next meeting is Monday, August 10th at 7 o'clock, and we will hopefully be voting on a plan at that time. With that, can I get a motion to adjourn?
I'll move to adjourn.
I'll support.
Moved by Mr. Abate, supported by Mr. Dashner. Mr. Abate, please call the roll.
Okay, Ms. Sanchow,
Yes.
Mr. Kennedy,
Yes.
I vote yes. Mr. Dashner,
Yes.
Mr. Schwegler,
Yes.
Mr. Tell,
Yeah.
and Mr. Clark.
Yes.
Motion passes. We are adjourned. Good night, everyone. Thank
Have
you.
a good night.
Thank you and good night, everyone.